talk every morning.
That is correct.
Right.
Hmm.
Greetings, everybody.
Hello.
Greetings.
Since
This is Soraya.
not picking up.
Okay, what's happened is that greetings, everybody. This is Dr. McIntosh. I thank you all for arriving on time. We still have about 5 minutes to 2, and we'll be admitting people through that time. This is the second in a series of health lectures that CMOTAP has done, and this one was basically by popular demand. And the issue we'll be discussing today is should Black people be distrustful of the healthcare system? But more importantly, is the distrust healthy or unhealthy? So we have a panel.
That was Dr. McIntosh.
Okay, can you tell me if you see that screen? Wave your hand if you see that screen. If you see, okay, so this flyer basically tells you all of our speakers and who they are. The first speaker we're going to hear from, and I'm not introducing her yet, but the first speaker is going to be Dr. Cornelia Randall. She's a professor of law, emeritus at, from several colleges. She has a background in medicine, was a nurse practitioner, and I, several years ago, read a paper she wrote, a section of a paper called The Basis of African American Distrust. And it was a part of a larger paper, and she can tell you a little bit about that. And later, I came into contact with Harriet Washington's medical apartheid. And I just noticed how much Dr. Randall had gotten into that small paper. Because both of those documents were very, very excellent. She's going to be our first speaker, and our other speakers will have the option of either responding to Dr. Randall's presentation or presenting new and separate material themselves. We also have with us Dr. Burnett Gallman. He's a gastroenterologist from Columbia, South Carolina. And more importantly, he's a member of the National Board of ASCAC, the Association for the Study of Classical African Civilization. We have with us Dr. Nima Hooker, is a family practitioner in Charlotte, North Carolina. I don't know if she's on yet. And we have Dr. Henry McCurtis. He's a psychiatrist, a psychoanalyst with specialty in addiction psychiatry. That doesn't begin to describe Dr. McCurtis. He was also one of my teachers. He was my director of residency training when I was a resident in psychiatry. So I always, and I'll repeat it more than once today, that I had Dr. Adelaide Sanford in elementary school, Dr. John Henry Clark in college, and Dr. Henry McCurtis in residency. If I say something wrong, it's not because I didn't have good teaching. I had very excellent teaching. We're also going to have at the end, he's not going to be able to arrive here until late, Dr. Arthur Lewis. He's a community healer, with a background in ophthalmology, but most of us know him for his most recent work as he tries to tell us healthy ways to live and to take care of our own health. We also have with us Dr. Shadidi Kinsey. She's a licensed acupuncturist and a director of the Peace Healthcare Center. She's well trained, and she also, among the people that played a role in her training, were Dr. Matulu Shakur, the political prisoner of war. We also have Dr. Keith Hunter. He's an academic physician. He has a background in, he's currently specializing in anesthesiology, but long ago, he used to be a rehab medicine doctor that we call also a physiatrist. And he did his internship in pediatrics. We have with us Dr. William Jones, who is currently a physiatrist and a director of pain management and rehabilitation at a clinic on Long Island. And then, of course, we have the founder of CMOTAP, Sister Betty Dobson. She's the co-chair of CMOTAP and the chair of CEMOTAP Ohio, and the author of Shared Secrets of Elder Sisters. We're going to be bringing her on as early as she comes in, just because she's just going to make an introductory remark or so. And then, of course, I'm your moderator. My name is James McIntosh, and I am her, and she can tell you more. I know that she has been involved in public health, worked in places like Washington and Alaska, and I know that she has been a professor of law, and that she has written some, I think, historic documents that everybody ought to read. I tried to distribute them to as many people as I could, but today you're going to hear it directly from her, and we're so happy to have her. Again, I find the contribution she's made so valuable that I gave each of our presenters the option that they can either simply respond to her remarks. I'm starting her off, and that, or otherwise they can present their own material, because everybody we have on the panel is distinguished in their own right. Dr. Randall.
Okay, I'm going to share my screen, and while I'm in the process of doing that, I want to say how appreciative I am of being invited to do this. It has been my life's work. Can you see my screen okay now?
Yes.
Okay, I'm going to put it on slides in a minute. As you mentioned, my interest in health started as a child when I watched my mother die from cancer and had to go visit her in a Black ward in a Philadelphia hospital in the 50s. There are numerous things like that occurred during my life, and I will mention some of them as they become relevant. But that started me off with my whole view about health being a primary area of interest. I have a master's in nursing, master's in public health, and I'm a nurse practitioner. I actually had a clinic in Seattle in the 70s, and I did itinerant public health nursing in Alaska. I ultimately went back to law school, and primarily because I wanted people to think I was smart. And I have to say, there's a stereotype, a Black woman and a nurse, and people don't think we're smart. And there's and that's a false stereotype. And there's a stereotype on lawyers where people think lawyers are smart. Again, a false stereotype, but nevertheless, I benefit from it. So what I want to do today is my view of things is systemic change. As a public health nurse, I work with individuals. But as a lawyer, I'm looking at system changes more so than what to do for the individual. These slides are going to be available on, I'll repeat this at the end, on patreon.com, Prof. V. Randall. I also have a website, racism.org, where I have regular updates on COVID-19 and racism, if you're interested. It's not just the law, but just mostly the law, but anything related to COVID-19 and racism. So COVID-19 has focused their attention on racial health disparities. All of us who've been working on this area understand how significant racial health disparities have been in our community dating back from the transatlantic slave trade. How we get other people to focus on it, it goes up and down, varying on how, if there's a particular problem that the white community wants to focus on, then if there's a racial health disparity in that problem, then they focus on racial health disparity. Unfortunately, they tend to focus narrowly around what to do about that particular problem, as opposed to what to do about eliminating racial health disparities. And COVID-19 has focused my slides are not the most recent, so the numbers have changed. This was back early in the epidemic. So, but they show you the racial difference in COVID-19 by race. And every group has has more health disparity, COVID-19 disparities and death disparities in white. Again, this is just another slide early on. I was very curious about the lack of race data being reported early on, because it was my impression from my experience as a professional that race-based data has been collected.
Yeah.
Race-based data has been collected by health departments, at least for the last 30, 40 years. And so for them not to be collecting race-based data or dispensing race-based data is an obvious choice, especially when they were dispensing gender data. And so it made me suspect from the very beginning that there was something they really didn't want us to know, because they dragged their feet on dispensing race-based data. So like I said, I'm going to quickly go through some statistics that show the pre-existing health disparities for COVID-19. I look at health disparities a little bit different than some people do, but I know that I'm talking to an audience of very informed people, so you may already be aware of a lot of this. For one thing, we have had excess deaths in our community year after year. At one point, it was estimated that 80,000 excess Black deaths occur each year. That means that 80,000 people die who would not die if we had the same death rate as whites. And despite that, no one has been focused and crying about, look, we've got to stop this excess death. And somebody needs to mute themselves, because I'm hearing an echo. Thank you. This other slide, I need to, I can't see my whole screen, so I need to figure out how to, I'm not sure which one this slide is, because I can't see the whole screen. I think this might be live deaths. I've got to figure out, excuse me just a minute, I have to stop and figure out how to turn on my whole screen. There's a bar up in front of my screen, and it's blocking part of what I'm seeing. Maybe I can just move it somewhere.
Okay, everyone, we're having a presentation right now from Dr. Cornelia Randall.
Okay. This slide, we've been hearing a lot about maternal deaths, and I like to look at statistics in terms of not just raw numbers compared white to Blacks, but to other countries, to say, what would we be if we were another country? And what we see is that Black maternal deaths is almost 4 times than white maternal deaths, And Ireland, the year that I did this, only had one maternal death per 100,000. Infant mortality, uh, again, we see that our infant mortality rate is higher than Barbados, Bahamas, Chile, all countries that we consider developing countries, which should say that this should give us pause. Even Cuba, at the time that I did this statistic, had better infant mortality rate than both white Americans and Black Americans. Life expectancy, and I always like life expectancy in terms to talk about because um, I'm having a senior
Mute
moment.
yourself.
Um, the oh God, I'm forgetting which agency it is right now. Um, there's a government agency, and I'm forgetting the name of it right now, who says that life expectancy is a measure of the quality of life in the country, the CIA. The CIA, you can go to their website. I checked it. The CIA still says this. Life expectancy is a measure of the quality of life in a country, except that they don't put up the life expectancy of Americans. But when we look at that, what that says based on their standard is that Black men have a poor quality life than men in Antigua, in the Bahamas, in the in Barbados, and in Chile. Similarly, Black female have a poorer quality of life than females in the Bahamas, in Barbados, and in Cuba. So the reason this is important is because we often want to function on individual behavior as opposed to saying, what is the quality of life that the people are living, as opposed to what in this behavior this individual is engaging in. Don't misunderstand me. When I'm a public health nurse sitting in front of a particular person, I talk to them about things that they can do. But as a public health nurse and a lawyer, I look at how we can change the system so that people in the entire system can have a better quality of life. I like to put up low birth weight newborns because I remember when one of the right wing commentators said that Black people should stop complaining because at least your life is better than what it would be if you were in Africa or in a country in Africa. But really, when you look at this, what this says is, well, we have more low birth weight newborns than almost every country in the world. There's only about 50, 60 countries that have a higher low birth weight newborns. So that says something about what is going on in our society, that Black Americans have more low birth weight newborns than Tanzania, Uganda, Ghana, Barbados. So my view, and I wrote in 1996, I wrote an article called Slavery, Segregation, and Racism. It ain't always easy to trust the healthcare system. And my view is that distrust of the healthcare system is a rational reaction to historical, widespread, and continuing racial discrimination. In fact, my view is the failure to be distrustful is to ignore our history. And both historical African and the transatlantic slave trade, Jim Crow, current day racism and neo-slavery. So this widespread, and most of the things that I'm talking about come from that article. I have not updated the data in 30 years, but you will see that it hasn't changed much in 30 years. So is the African American distrust of the healthcare system is built on a history that includes widespread discrimination, sickle cell screening initiative, family planning, involuntary sterilization, and the participation of the medical system in the justification of racism and discrimination. And the important point is people do not have to know every single thing to know that this is happening to them, to know that this has happened to their families, their friends, their ancestors, their aunts and uncles, their great aunts and uncles. There is a history that we know, even if we cannot recite the specific incidents. So, for example, participation in justifying racism. The medical community, particularly academic physicians, were very active in advocating the theories that Blacks were biologically inferior to whites. And medicine has been built on that. Now, they've spent decades and centuries trying to strip that out, but it's still there. Southern oriented medical education even developed unique diseases for African American, for Black slaves, such as drapetomania, which was the disease causing Negroes to run away, because obviously no mentally healthy Negro would run away from their master. You can't, so you have that kind of history built into medicine and built into our understanding of how these systems work against us. We had widespread experimentation during slavery, and I've listed a number of them. Two of them I've highlighted. Dr. Thomas Hamilton, who did heat intolerance studies by putting slaves in pits and then putting charcoal heat all around them so as to see how much heat could a slave tolerate in order to develop better mechanisms of having enslaved people work. We all know about Miriam Sims and the repeated gynecological surgery, even though he's the father, quote, of gynecological surgery, he developed that on many, many women. And he didn't use pain medicine because he felt that that Blacks didn't experience pain. And on one woman, he did the repeated surgery 30, 40, 50 times on one woman. And yet he is admired in the medical community as the father of gynecological surgery, which he is. I don't have an objection to them noting that he developed all this. I have an objection to them not saying how he did it and making that clear. But when we've had that experimentation during slavery, and those of us, Deas, descendants of Africans enslaved in the United States, is a term that I like to use. Some people use indigenous Blacks, but the idea is that if you have your history out of slavery, you have an ancestor who went through this, who was experimented on, and who saw other people experimented on by the so-called doctors. Certainly we know about post-slavery experimentation, and everybody knows about the Tuskegee syphilis experiment, but there were live cancer cells experiment, there was supercoil experiment, in the 70s to see if the supercoil would prevent pregnancy and or induce abortion. The genetically testing for criminality on thousands and thousands of children without their parents' consent, without their parents knowing, and without their parents' consent. I just remembered something that I wanted to say, and I want to say it now before I forget. Uh, if you are not already familiar with Dr. Michael Bird and Dr. Linda Clayton's work, An American Health Dilemma, a medical history of African Americans and the problem of race. They have 2 volumes. One is from the beginnings to 1900, and the other one was from 1900 to 2000. If you're not familiar with those, these are encyclopedia. They should be a part of everyone's library. And a lot of the information I know about is built upon their work. Prison and military abuse, because it's not that prisons and military focus their experimentation and abuse on Blacks. It's that we're overrepresented in those areas. And so anything that is done in terms of uh, experimentation and abuse is going to be disproportionate in Black people. And there were all kinds of experimentation that continue to today. My examples come before the date that I did this, but I guarantee you if I was to update this, I could find things that was done after 1900, after 1980, and in the 2000s. It's still, and there was a law and that forced military people to take experimental vaccines. I don't know to what extent the military was used to test COVID-19, but I wouldn't be surprised if it was a large number of those were military men who did not have an option to say no. The other area that contribute to Black distrust of the healthcare system for anyone who was an adult in the 70s was the sickle cell screening debacle. I was a practicing public health nurse at that point. And the purpose it was to change African American mating behavior to get people to think about whether or not they were a carrier versus someone with the disease, so that when they decide to have children, that they would understand that what the risk was in terms of having a child with the disease. The execution was horrible, which goes to the whole thing with COVID-19 and the vaccine. It's one thing to say that it's safe, it's other thing to say it's going to be executed in a way that's non-racist, that is going to not be problematic. The sickle cell screening debacle promoted confusion. People didn't really understand the difference between being a carrier and having the disease. And the government didn't really try to clear that confusion up. And so schools were requiring Black children who were 6 years old to be screened, requiring prisoners to be screened. 2 groups who it wasn't important that they be screened. In theory, prisoners are not having children because they're in prisons, and Black children that are 6 years old don't need genetic counseling for reproduction. And so forcing screening on those children just caused stress in their parents. There was widespread job and insurance discrimination against carriers, not just against people who had the disease, but once you was identified as being a carrier of the trait, the jobs discriminated, insurance discriminated. The military considered banning Blacks altogether, and many Black airline stewardesses were fired at that time. So when you look at a government program designed to help us with good intentions, in a racist society, everything that can go wrong does go wrong. And I think that if you don't go into that, my view is that as a Black person, you have to take that into consideration as you evaluate things. Each step has to be evaluated separately to see what's the possible things that can go wrong and how can I protect myself. Family planning and sterilization was another area. It's from its very beginning was about Black population control. I wrote in 1996 that Margaret Sanger was a racist, and my colleagues was all upset. And now 30 years later, family planning is admitting the racial nature of her behavior and attitudes, and widespread sterilization. Again, the point being everything that people have ulterior motives in terms of why they do things. And as Black people, you kind of have to think about what could be their ulterior motives. So that's historical, but there's more than historical things that contribute to Black people's distrust of the healthcare system. And I've listed a number. I'm not going to go into all of these, but abortion, the widespread availability of abortion, the restriction of abortion, both of them, it doesn't matter where you're pro-life or pro-choice, both of them sort of come from a point of using Black people for something more than what Black people might want to be used. The Human Genome Project and genetic testing, managed care, organ transplant, reproductive technology, not just abortion, not just sterilization, but the whole range of reproductive technology presents issues of lack of access, lack of quality for Black people. And all of that, when people go about their lives trying to live their lives doing things and get discriminated against in these areas, that builds a distrust of the healthcare system. So I want to go into a little bit more detail on disparate health status. I try to distinguish between health disparities and health. So someone can have poor health and we can work with them on their poor health. Health disparities is about the gap between the health between Black and whites. And I think that's important because people often want to give solutions that they think are race-based solutions and they're class-based solutions. Okay, so my answers, when someone says to me, if you want to know whether something is a race-based race-based issue, you have to control for class. What you have to ask yourself is middle-class Blacks having a different life expectancy than middle-class whites? Then you have a race issue. If you say poor Blacks have a shorter life than middle-class Blacks, that's not a race issue. That's a class issue. And too often what I find is people want to use class differences to say that they're working on race. Okay, don't get me wrong, there is good reason to work on class issues. There are huge class problems in this country. And if we eliminated some of the class problems, yes, that would eliminate some of the issues for Black people, but it won't eliminate racial issues. Racial issues can only be eliminated by looking at what's happening between similarly situated Blacks and whites. Whether you're talking about class, whether you're talking about behavior. When people say to me, Black people so unhealthy because they eat all this bad food. And I'm like, so are you saying that they're more unhealthy than white people? It may be that Black and white people need to change their eating behavior, but Black people, the health disparities doesn't exist because of Black behavior, unless you're saying that white people with the same behavior, uh, that white people have a different behavior and consequently have a better health. White people of the same class have different behavior and consequently have better health. But we know that the class difference results in significant life differences. So we know when I first did my book, Dying While Black, in 2006, in a county in Ohio, they did a study and they came up with Akron area, did a study, and they found that low-income whites lived 3 years longer than low-income Blacks. But they found middle-income whites lived 10 years longer than middle-income Blacks. And so that shows, now, they also found that middle-income whites lived longer than low-income whites. That's a class difference. And middle-income Blacks live longer than low-income Blacks. That's a class difference. But the race difference here is that even when you're in middle income, you have a racial disparity in class. This is a low birth weight chart that I like to show because if you use education as a proxy for class, what you see at every level is that there's a Black and white racial difference at every level. Significant difference at every level. But take a look, compare Blacks who have 13 or more years of education, the low birth weight, to whites who didn't graduate from high school. And notice that highly educated Blacks have more low birth weight babies than white people who didn't graduate from high school. So that should tell you that what's going on in race is significant. Because what we know is that, what I believe, I don't know, what I believe is that Black people who are middle income eat like white people who are middle income, go to gyms like white people who are middle income, run around their neighborhood like white people who are middle income. So why this disparity? This slide just show you there, points it out. Okay, so here's my theory. That we have an intergenerational impact that is passed on through transgenetically. That slavery we all have the same genes, but we know that not all genes operate the same way. And we know that stress causes genes to operate differently. And we know that that difference in how genes operate can be passed.
Muted.
So what we have is slavery, legal apartheid, racism, neo-slavery that has impacted us in our communities. And we have communities that are living with lack of wealth, lack of education, criminal justice, go down the list. And yes, people have a responsibility for the individual behavior choices they make, but those choices are made in the context of the lives they can live. You can't exactly do good water if they're pumping in bad water in your community. You can't say exercise if there's no sidewalks and lighting and all that stuff that is needed to do it. And so I read a study once that said that the best way to reduce pregnancy was to increase the income of the family. That they found better than birth control, better than anything you give. If you want to change individual behavior, change the environment in which they live. And that's where I am coming from. So yeah, chronic racial stress and COVID-19. So yes, we have a lot of it because we got all of the problems that are due to chronic racial stress. And it shouldn't be surprised. And it's not just about being essential workers. It's not, that contributes to it. It's not just about not being able to get off to work and it's about racial health disparities that we went into COVID-19 with. So the other problem that contributes to distrust is the healthcare system itself. So we have all kinds of barriers to have healthcare, and you know them. We don't have universal access. We don't have a good healthcare system. If you ever want to find out about that, look at a show called Health Around the World, Sick Around the World. I'll think of it in a minute. It goes to 5 capitalist countries and look at their healthcare system compared to our healthcare system. And they asked the guy in Taiwan, because Taiwan built a new healthcare system up about 25 years ago. And they asked them, so you studied all these healthcare systems, what did you think of the United States healthcare system? And the guy from Taiwan said, laughed, chuckled more, he didn't laugh, and said, well, the United States doesn't have a healthcare system, it has a market. And so they actually didn't take anything from our so-called serious system. So we have lack of universal access, barriers to hospitals, barriers to nursing home, barriers to physicians and other private providers. And during COVID-19, no one's talking about eliminating those barriers. No one's saying, you've got all these barriers to healthcare. We're going to open up clinics in your community. Not we're going to drive in a COVID-19 vaccine thing, but we're actually going to assure you better access. We're going to remove these barriers that have built distrust. And it's hard to have trust for a system that has just closed your only community hospital, one of the few hospitals in your community that served Black people. That was in Dayton, Ohio. Recently, they closed a hospital, but now they're like, you need to get on board to protect the health of the community and to protect the health of yourself. And the question becomes, well, where are you in assuring us access? The other area that I want to talk a bit about is discrimination in medical treatment, because that distrust And we all know, we've heard, and I don't forget which one it was, but there was a recent study talking about, oh, surprise, surprise, there's this disparity in treatment. And I'm like, oh boy, there's tons of studies dating 70 years that show disparity in treatment. This is not new. What continues is the refusal to actually get to find a way to get rid of that disparity in medical treatment. But every time you hear about the study, every time you have a family member go in, my sister was told that Black people didn't get MS, so that's why we're not going to test you for MS. I had to advocate for my son not to be discharged in an outpatient setting. And the only way I was able to get it was to threaten them with a lawsuit. I basically said, okay, you discharge them. You did. Look, my son is 6'6" and 300 pounds. And I think he will have a problem walking, but you discharge him. You put in his chart that you are discharging him over the objection of his mother, and that her specific objection is that he is not capable of walking. I'll take him home. If he falls, I sue. They ran away. They were gone for about 2 hours, and then they came back and said, okay, we're going to keep him. Why did they say that? I don't know. Probably because their lawyer told them that if they put that in the chart and something happened, they would be liable. And so they decided the better thing would be to keep him. But we all have family members. It's like police shootings. You always know someone who's had some problem with the healthcare system. So how is it that we can trust a healthcare system where in the everyday working of the healthcare system, they discriminate? They give you less treatment, they give you poor treatment, or they overtreat. I mean, the amputation is about overtreatment. So my thing is we need to focus on eliminating health disparities, and we need to force them into a conversation about that. If they're so interested, because they're scared right now, and all of us are, I'm not minimizing it. I'm not trying to say I run around with no mask or anything. I wear my mask, and my son who I live with does all the shopping. But this is a time that we could use to focus on eliminating health disparities by focusing the discussion not on COVID-19, but on health disparities, and saying to them, if you can't just talk to us about something because it's important to you, you got to talk to us about what's important to us. And COVID-19 is important to us because it's just another health disparity. And what we want to talk about is how to eliminate health disparities, including COVID-19. I've been through this. I'm not going to go through it again. So as I said, I'm winding up. Black people's distrust of healthcare, in my estimation, is a healthy response to a society that discriminates based on race. I don't know how else we could expect people not to be. Now, we've got to find a way to get around that, but it's not because Black people are having an unhealthy response. My view, and this goes to my view of system changes, I think that we've got to eliminate discrimination. And one of the problems we have is in this society, discrimination is legal in this society. Most people think that racial discrimination is illegal. It's not. Only intentional racial discrimination is illegal. Now look, I taught criminal law, and I taught tort law, and I taught anti-discrimination law. In criminal law and tort law, there is a continuum of responsibility. You're responsible if you're intentional, clearly. If you intend to do something, you're responsible. But you're also responsible if you're reckless. That is, you didn't intend it, but there was a high risk that this was going to happen, and you knew of the high risk, and you did it anyway. You can be responsible if you're reckless. You can be responsible if you're negligent. That means there's a risk of something happening. You may or may not know of the risk, but you should know of the risk. And you should take actions to do something. You know why the supermarket puts a sign, wet floor? Because there's a risk of falling. They need to take action to make sure that you know that there's a risk of falling. And if you decide to walk on a wet floor, then they've done their duty. If there's a negligence says that if there's, and then the other state is called strict liability, before I get off. Strict liability, and there's both negligence strict liability and criminal law strict liability. In both of those, you don't have to be intentional, you don't have to be reckless, you don't have to be negligent, you just have to do the act, you know. No one cares why you ran the red light. It's not a part of what goes into finding you guilty. It's a strict liability crime.
And goes, is that your food in the fridge? I'm gonna put your
Discrimination
name on it.
discrimination is the same way. It's not the same way. Discrimination law only focus on intentional and only on a narrow form of intentional. And in fact, in the last 25 years, it is now impossible to get into court on most intentional discrimination because the courts have said that you can't sue for disparate impact discrimination. You can only file a complaint with the agency. And I put this slide out of order and didn't realize it. And the reason this is important is because most discrimination these days is in this bottom left quadrant box. Nobody's intentionally discriminating. They are negligent, recklessly discriminating. But that's legal, and we need to make it illegal. And we need a law that says that. Now, what would be strict liability? We'd have to think about that in the terms of health, but I can think of one real quick in terms of policing. I would say, if you shoot someone in the back, we don't care what your state of mind was. Shooting him in the back, that's it. Okay, you are strictly liable for that. So the thing to remember, I'm at the end, and the thing to remember is whatever the law does not forbid, it permits. And in the United States, it permits racial discrimination. And that promotes distrust, because when you're discriminated in any system, it doesn't have to just be in healthcare, it makes you distrustful of the whole system. And I think that system-wise, the best thing we could do to make a system change that would help eliminate distrust is to eliminate racial discrimination. I'm at the end. Thank you.
Like 7 minutes later or so. I'm waiting. I had it on both.
Okay, Doc, I'm going to stop the share. There are a lot of people that are still coming in. I got to get everybody muted here. Can you end your screen share there?
Yeah, I'll end it. There we go.
Great. All right. Thank you so much, Dr. Randall. Outstanding. I know people have been asking questions even as we go through the chat. So I'm going to ask you if you have a question for Dr. Randall to please put it in the chat, and we will take it. If you put it in before, put it in now. We'll ask if it's a question that we can ask. This says, how do we as a people fix this issue? That comes from Doris Ambrose.
Which issue?
I guess she was speaking about the health disparity.
My thing at the end is I think this is a complex problem with a lot of different solutions. And so I'm coming from this as a lawyer who wants to fix. And I think that one of the things we can do is make racial discrimination illegal. There's a Convention on Elimination of All Forms of Racial Discrimination, which is a treaty that we have signed but refuse to implement. Because the treaty requires all forms of racial discrimination to be outlawed. And the first thing we could do, and I think one of the things we could do is, while Biden is trying to build his legacy and show how friendly he is to Black people, we should demand, and while the Senate and the House is in control of the Democrats, this would be an opportune time to demand that the racial discrimination laws be fixed. At a minimum, fix Sandoval, but personally, I would like to see a different, broader law.
We have a question from Christopher. Maybe it was from one of the Williams, someone named Williams. The bottom line is that they want to know the name of that 2-volume set that you said.
Okay, the name is An American Health Dilemma, a medical history of African Americans and the problem of race, beginnings to, the first volume is beginnings to 1900. It was published in 2000. And the second volume is 1900 to 2000, and it was published in 2002. And when I say it's an encyclopedia, it's an encyclopedia.
And who is it by?
It's by 2 Black medical doctors, Dr. Michael Bird, B-R-Y-D, and Dr. Linda Clayton.
Is that B-Y or B-I-R-D? Bird.
B-R-Y-D.
B-R-Y-D.
Correct.
And
B-R-Y-D.
I'm sorry, B-Y-R-D?
No, B-R-Y-D.
B-R-Y-D. Okay. And Linda Clayton?
Correct.
Okay, what I did was to write it in the chart, and I would just send it to everybody right now. And you can get it. It's American Health Dilemma. Any other questions? All right. If there are no other questions, let me inform everybody. Dr. Hooker.
Question.
Okay, you have to write it in the chat. You have to write it in the chat. The chat is on the bottom. There's a bottom, you'll see a little bubble, and it says chat. Okay, I asked you if you wrote it before to write it again. I'm sorry. Please stop talking into the meeting. Just write your chat. Write it in the chat, and I'll get it. Write it now, and I'll take your question. Okay, so it's, what is your response to, this is from Pat Lofton, what is your response to the statement, if so many white people are taking the vaccine, why do Black people distrust the vaccine? That's from Pat Lofton.
Well, you know, so many white people got a lot of things that didn't hurt them. And Black people, it may be that our distrust is born from our history. And the fact that white people, and I'm not sure that a good measure of whether or not we should trust the healthcare system is the fact that white people are using it. White people go in for pain, for work, help on lots of things and get treated better and different. I don't think that's an argument to help Black people trust the system. I think a better argument would be, I think that people should acknowledge the validity of the distrust and say, your distrust is valid. and we understand where it comes from. What can we do to help you feel better about what we're doing? But everybody wants to make Black people say, just be trustful because we say be trustful. And for a lot of people, that's just not going to work.
There's another question. It is, what is your response to the statement? Oh, we have that already. Okay, here's the question. There have been some recent technical papers that mention geographical variables and also vitamin D. Do you have any comments on the effects of these variables as to how it affects African Americans? That is from STP DVE 18.
I have been reading I've been reading on that. My view is that the stress, chronic intergenerational stress, affects our whole body, and it's not surprising if it affects things like our how we process vitamin D and other things, but I'm really not knowledgeable enough to be able to comment on the validity of that. I'm just not surprised by it.
William Jones asked the question, what are your recommendations for the COVID vaccine?
I don't have a recommendation. What I am doing is I'm waiting. I'm over 70. I have multiple chronic illnesses, but I plan to wait 6 to 12 months after they vaccine the larger population who is not in a study to see what impact it has. And I plan to wear a mask. I plan to social distance. My son is planning to wear a mask and social distance. I think that I'll probably take the vaccine at some time, but I'm not taking it now.
Okay. And a question from Fitzgerald Bonton is, what are examples of ways the law tolerates racial discrimination? And that's going to have to be our last question because of time.
Oh, well, okay. You move a hospital, you're going to move a hospital from a area that is.
Please unmute yourself, Dr. Randall. Unmute yourself.
So essentially the law tolerates anything that's not intentional. So just think about all of the stuff that happens in the healthcare environment that is not intentional. And by intentional, I mean the person said, we hate Black people, and the reason we're doing this is because we don't like Black people. If they don't say that, then it ain't intentional. If they do it be to save money, if their primary focus, and the law will tolerate it, even if there's some racial animosity, if they have a focus, if they have a.
Dr. Randall, you're muted again. You're muted again.
We are moving the hospital in the Black community to a suburban white community, and then telling the Black community, you need to drive to the suburban white community to get health care. That's acceptable because they had economic reasons, supposedly. But the problem becomes is you can always find the reason. That's why we need something more than intentional. We need negligent, and we need strict liability. We may say, unless you show a hospital is losing money, you can't close down hospitals and doctors and clinics in communities. Society is about law. We make laws because to form the kind of society we want. Why don't we make laws saying to people, no, you can't just make more money. You can't just say you want to make more money. You have a responsibility to have a hospital, to have grocery stores in communities. And no, you can't get a permit to put a grocery store in the suburbia until you put a grocery store in the Black community. We won't do that, but we could. We do it with alcohol. We make people get permits. We control where they can be. Why can't we control where food is?
Excellent. Dr. Randall, I want to thank you for your excellent presentation today. I don't know how much time you have. I know that our next speaker is on a very tight schedule, and he would like to respond to your comments. I told you he was my instructor in residency training. He's a brilliant psychiatrist and psychoanalyst. I'm going to call now for Dr. Henry McCurtis. And thank you again, Dr. Randall. Dr. McCurtis?
Yes. Dr. McIntosh, thank you, and Sister Betty Dobson, for this opportunity to meet Professor Randall and to hear her comprehensive presentation about the inequities that confront our people. I think in the spirit of Byron and Clayton, as well as Harriet Washington, Professor Randall lays out something in the 20th century. At the beginning, all three books came out at the beginning of the 21st century. And we say that crisis is an opportunity. And Dr. Randall has laid out in her book, Dying While Black, the opportunity that we must seize upon in order to tackle this problem of discrimination that continues to perpetuate health disparities that are now baked into the system. She gives us a remedy, and she didn't mention it here, but I'll say it, that puts teeth to HR 40. If we could get our Democratic Congress, our president, to begin to look seriously at HR 40 with the recommendations that Dr. Randall in her book clearly lays out as to how to develop a law that makes discrimination illegal. Now, she clearly, as she and I both are children of Title VI, she eloquently describes that. She points out how it has been defanged and rendered impotent, if not a racist law in and of itself. But she has a remedy that, if attached to a law that essentially it's not reparations, it's a different type of reparations. I would ask her to come in and explain that a little later, but this is what we need. We need to take this COVID crisis and turn it into an opportunity. Yes, back to your theme in terms of trust, we would be in denial if we ignored the history of the terrors and atrocities that have been bestowed upon our people. But we can't become so focused and so narrow that we're not able to see opportunity. Even in Harriet Washington's book, she points out that her documentation of these horrors, she does not intend for us not to be vigilant, but at the same time to push the medical establishment toward providing equity. Dr. Randall is pointing out the way to eliminate inequities. So it's in these three tombs, but especially in Dr. Randall's, I would advise people to carefully read, also to listen to her presentations. You have to sort of listen to them over and over because, as you said earlier, they are packed. And it is just a pleasure to be able to listen to this and to see a logical, concise, first historical presentation, all bringing us all the way from the trek, she calls it, all the way into slavery, into the Jim Crow apartheid, into this current situation that we're in, discrimination being at the crux of the health disparities that impact the quality of our lives and reduce our life expectancy. So really, once again, thank you so much. And it has been a pleasure. Dr. McIntosh, you have become my teacher because you introduced me to three people in this, your forum. Dr. Hooker mentioned them in the last forum. And then when you asked me to be a part of this, I didn't know Dr. Randall, but I know her now. And I appreciate that so very much. Thank you.
Wonderful. Thank you, Dr. McCurtis. I guess it's interesting you mentioned Dr. Hooker's name because she's the other person with pressing time emergency on her. And so I thank you for your remarks. There's something to also study. I know what HR 40 is, but would you just say you said the word one time, but what is HR 40?
HR 40 is a bill that has been presented in the House of Representatives. I think Dellum started to present it many years ago for reparations. And it has been continued now to be presented. It's there now. And it requests a commission to study how we would structure reparations. And essentially, as I say, when I read Dr. Randall's book and I saw in her recommendation, I said, this is it. This is it. This is the opportunity. COVID, we can take that lemon and make lemonade. I mean, that's the.
Thank you. Thank you so much, Dr. McCurtis. And hopefully we'll get to talk later, but I know that you have other things to do. And I thank you for taking out of your busy schedule to join us today. And it was very important that you be here. Our next speaker is Dr. Nima Hooker, my African niece. And she has some family obligations she's going to have to tend to. She's a board certified family practitioner from Charlotte, North Carolina. I've been signaling for her to unmute herself. And if you've unmuted yourself, please start, Dr. Hooker.
Yes, thank you. Sorry, I'm like running around here with my nieces. Good afternoon, everyone. I'm Dr. Naima Hooker. As my Uncle James said, I am in Charlotte, North Carolina, and I'm practicing family medicine. And I think I was a part of the first discussion a little over a month ago and came back for round two. And I didn't really prepare anything specifically to talk about, but I was just kind of, keeping the question in the back of my mind over the last few weeks so that I would be prepared to say something. And I guess after listening to Dr. Randall, thank you for that presentation. That was wonderful. Um, a quote came to my mind by Dr. Barashongo, one of our ancestors now, who says, you know, we live in a hostile white supremacist society. And we kind of always have to keep that in the forefront of our minds whenever we're maneuvering the society. And the question is, does Black distrust during the COVID pandemic, or is Black distrust during the COVID pandemic healthy or unhealthy? And I think the answer to that, as Dr. Randall was saying, is yes, it's healthy. It's our reaction to what we have gone through historically in this country. So I always say be skeptical, like you said, be distrustful so that you're able to use the information that's presented to you in order to make a decision that's going to be the best decision for you. Because living in this society, it's hard to figure out when everything is against you, what is a decision to make that would be the best out of the, what's the quote that's out there? The best decision based
Optimal.
on, yes, the optimal decision. So that's kind of what I wanted to say. There was a article that went out today that said, we know we're at like 400,000 deaths from COVID-19 in the country total, and 50,000 deaths from African Americans that's been recorded. There's like, I think like 300,000 or something like that that weren't accounted for. So I don't know what percentage of that would be African American, but the numbers are rising nonetheless. And about 30 to 40% of African Americans know someone who's been affected by it or has died from it. So it's a real concern, and trying to figure out the best way to maneuver this has been a challenge for myself and how to direct my patients. I will say I got the vaccine. I got both doses already, had the second one last week. And the first one I felt fine. I had a little, arm soreness, and the second one I had a little bit of like headache and fatigue for a couple of days, but it was fine after that. And one of my friends that I kind of talk about, COVID-19 through text messages and stuff, we all kind of got it around the same time. And they were like, so you got the vaccine, what do you think? I was like, I still don't trust it, but I got it anyway because I feel like it's the best, decision to make for ourselves. There are healthy people who are dying from COVID-19 with no pre-existing conditions, and with the work that I do, being around people who could potentially have it, I just felt was the best decision for myself. So I think one of the best things we can do, to help with trust is to choose Black. So, trying to choose Black doctors when we are looking for someone to take care of our health. And we know that, we've been trained in the Eurocentric capacity. So still that's some, what's the word I'm looking for? Still some bias there in our training period. But I think with all of the research that's out now stating that mortality rates are higher for African Americans who don't have African American providers, that's enough for me to say that that's probably one of the best things you can do for your health in general, and especially during these times. And just, trying to stay informed. But even outside of that, if you have to have a lawyer or teacher or whatever, you have the ability to make decisions for yourself, trying to choose those professionals to be Black professionals and hope that they have some sense of community and be able to give you a more community and African American minded guidance. So that's kind of what all I had to say is, being in primary care, I talk to patients about COVID-19 every day and trying to give them guidance. And A lot of patients, I would say, don't necessarily say they have distrust, and that just may not be words that they use directly, but they more so are listening to the news and are worried about side effects from it. And so I kind of just give them the facts of what's out there versus what's being publicized in the media. I guess if anybody has any questions, I can try to answer those, but that was kind of all I had.
Dr. Hooker, I also have Keith has to speak right now. And I thank you for coming in. And I want to remind everybody you were on the front lines and you shared with us the decision that you made based on your situations, that you have to deal with patients every day that have it. And we appreciate your sharing that with us and for giving us your take on the presentation by Dr. Randall. And thank you for taking from your busy schedule to join us today.
No problem.
Thank you so much. Okay. So next we have Dr. Gallman, the gastroenterologist, or Dr. Hunter. I'll let them decide between them who's going to go first. Dr. Hunter, if you have some time pressures, you can you can go now, but you have to unmute yourself. Dr. Hunter?
I
Dr.
do not
Gallman?
have any. I do not have any time pressures at the moment.
Okay. So then we were going to, I think, start with, which order did we do it last time? You went first and then Dr. Gorman, right? So if Dr. Gorman's okay with it, I'm going to have you go now again. This is Dr. Jawara Hunter. I told you he's currently an anesthesiologist. His background before that was in rehab medicine. And even before that, he did an internship in pediatrics. He's African-centered and Afrocentric doctor. And we'd like him to give his remarks. I think you wanted to comment a little bit about policy. Is that right, Doctor? What are the implications of our distrust, or the consequences of our distrust? Was that what you were saying to me?
Yeah, I think that's a good summation. I've been following Dr. Randall for a while, and I think that she's been doing a great job for a long time gathering this information. I want to give a shout out to Dr. McCurtis, who has helped my family over the years in many ways, more numerous to count. So we want to thank him publicly. Also want to thank James and Betty Dobson for pulling this together. Just appreciate you all so very much. I'm going to try to keep it to 15 or 20 minutes and turn off Horace Silver so that we can kind of get a flavor. Can I do the share
Did you need a
screen?
screen share?
Yes, sir.
Okay, here you go. All right, try it now.
I think that looks good. I can't get rid of this iTunes thing, but if y'all want to take a look, these are two of my favorite people right there. Some of these remarks that I'm making come from a paper that I did in 2001, Reparations for Health Disparity Prepared for in COBRA. And there's some action going on in different academics kind of working on this. And basically, if you look at the table of contents, I'll try to expand a little bit here. What I tried to lay out is that from the Philadelphia Negro written by Du Bois to An American Dilemma written by Myrdal, the Kerner Commission, Reporter Secretary's Task Force on Minority Health, American Health Dilemma, as Dr. Randall has identified, these issues about health disparities are not new. Philadelphia Negro was written in the 1890s by Du Bois. So I'm pulling a little bit from here, and I'll try to go right into the presentation. So let's do it this way. I think it's pretty well established that we have reason to mistrust the health system. I am not a public health expert, as Dr. Randall is. However, I've been dabbling in it for a while, so I'm a student, and I'm just going to share some thoughts and ideas that we can kind of hopefully have a place for some discussion, and hopefully some looks at some possible correctives to ameliorate. So the question that I pose is public health for Africans our responsibility? And my answer to that is yes. I think we can all agree, at least most of those on this discussion pretty much feel that there's been a lot of flaws and failures in the prior, well, in the way that public health has been practiced in this country. And again, the book by Burden Clayton, the book by Harry Washington, and those I listed, the Philadelphia Negro, Kerner Commission, American Health Dilemma, all of those books kind of identify the same issue. But I think that yes, it's our responsibility. So my focus is kind of gonna be on what we can do. Real briefly, because I didn't do a COVID presentation this time per se, but I did want to kind of back up and follow up on something that we had talked about before. There was an issue relating to efficacy. And efficacy is a word used in medicine, meaning how effective something is. Okay, so I wanted to bring to you this website here, WPFWFM.org. They are the sister station in DC to WBAI. And I want you to write this one down. The archives, the show is called To Your Health. It's December 28th, 2020. Now, the reason I identified that is because there's a brother who's an MD and a PhD in synthetic chemistry. So he's a really learned, well-researched brother. And he has done looking at the data that Pfizer and Moderna presented to the FDA in order to get what they got. So what he identifies in the data, and this is all the data we have, is that after the 2 doses of the Moderna or the Pfizer, the research they had done up to that point that they stopped the research gathering, the data gathering, was that after 14 days, the group that had received the vaccine was able to identify a decreased potential to get very.
They're talking about COVID.
Somebody's on.
Yeah.
Again, I'll repeat that. At 14 days, they identified, and they stopped the study basically, where they found that if somebody got severe COVID, they would be less likely to be in the ICU and intubated and, you know, have a really bad outcome. That's what the data shows. It does not go anything beyond 14 days. Now, what the synthetic chemist said is that there is no data to identify that these vaccines prevent one from getting COVID, nor asymptomatic spread. Asymptomatic spread is probably the thing that we're the most fearful of. Again, as I mentioned before, one of my best friends in the Bronx, who Dr. McIntosh knows very well, got it from his son, and he's 72, 73 years old. He chose not to go to the hospital, and his wife is a really, really good natural cook and vitamin person, but he was on the edge. But all that I'm saying is that none of the data that they presented identified it stopping asymptomatic spread. It does not prevent COVID. People who have gotten the vaccine apparently have gotten infected with COVID again, sometimes because they don't practice social distancing and things like that. Finishing this concept up, the emergency use authorization, which these 2 entities got, is not an approval. And the scientist, the PhD in synthetic chemistry, a brother man, said approval usually takes 7 to 10 years. So I just wanted you all to kind of digest that for a while. I think it's important. That's my COVID update. I think Dr. Gorman's going to have a lot more on COVID. Okay, following up on what Dr. Hooker said, and we didn't plan this, but I think that since she's my niece, we did plan it. Does mistrust among our people extend to African practitioners? And again, I would say, you know, it's a mixed bag. I live in DC. I know maybe 15, 20 African cardiologists, not all African centered, but they really care about their patients. So are our people wary of African healers? I think it's a problem. I think it's, you know, some people are quite wary, some people are not as, but it's also something that we need to be clear about, that we have to build that trust. And again, trust is in your word, mistrust, Dr. McIntosh. And from Bird and Clayton, there's this history of the almshouses, ALMS, almshouses. Almshouses were these places where people would go if they got sick. And Africans were very, very afraid of sending their family there because they would not come out, they would die. So a lot of people would rather go to the natural healer in the community. My next question is, why do we suffer and die from preventable diseases? I think Dr. Randall covered that quite a bit. Dr. Hooker talked about it. I've talked to Dr. Gallman about this, and we've had conversations. And the concept of excess deaths is a piece that I've struggled with for the last, I don't know, 25, 30 years. The gold standard of health is basically life expectancy and infant mortality. I would encourage everybody who has not kind of familiarized themselves with the Cuban healthcare system. One of the things I don't think we recognize, you know, apparently one of the best things that Fidel did was provide healthcare to all Cubans, because Black Cubans were getting terrible healthcare prior to that. And you see with the thrust that they've had incredible success as one of the leaders. And of course, they've been doing things all over the world. The concept that we have in terms of morbidity, not mortality, but morbidity, are the years of quality of life lost to African families and the burden of taking care of a family member who has a morbidity. The book that Dr. Randall referenced is called An American Health Dilemma. Bird and Clayton named it after this book called An American Dilemma by Gunnar Myrdal in 1940. Gunnar Myrdal was contracted by United States, I don't know, Pew Foundation, one of these big foundations. He was a Swiss or Swedish economist, and he was to look at Black and white issues inside the United States. My dear friend, Dr. Harrell, says that Du Bois already had the champagne ready to go because he knew he was going to get the call, but he didn't. They gave it to Myrdal. But anyway, the American dilemma is what? The American dilemma is the difference between what the American ethos states, that we believe in equality, egalitarianism, humanity, and their obvious mistreatment of Black folks. So that's the American dilemma. So anyway, a couple of quotes from Myrdal. I don't like to read it, but I'll read it kind of slowly. There is no doubt that the overwhelming majority of white Americans desire that there be as few Negroes as possible in America. If these Negroes could be eliminated from America or greatly decreased in numbers, this would meet the whites' approval, provided that it could be accomplished by means which are also approved. 1940. Myrdal again, quotes, the dominant American valuation is that the Negro should be eliminated from the American scene, but slowly. Equalization of health conditions, even without advanced medical knowledge, will pull Negro death rates down sharply. And I think one more by Myrdal. What is needed in the way of special attention to Negroes is constant vigilance against popular and official prejudice in the applications of a general medical and health program. In view of the racial attitudes prevalent in the South, it is almost necessary that national organizations, and specifically the federal government, take a firm lead in this work. 1940. And basically the things that Du Bois had said prior to that in the Philadelphia Negro mirrored this. Now, 1985, report of the Secretary's Task Force on Black Minority Health, quote, in analyzing data from 79 to 81, the task force identified 6 causes of death that together account for greater than 80% of the mortality observed among Blacks and other minority groups, in excess of that of the white population. So we got 6 causes of deaths that they were focusing on, and 80% of the mortality observed by these things. And again, my constant refrain is many are preventable. Cancer of the prostate, colon cancer, breast cancer if caught early, lung cancer if caught early, preventable. Cardiovascular disease, heart disease, stroke, caught early. Chemical dependency with appropriate treatment by the likes of Dr. Curtis and Dr. McIntosh. Diabetes, treatable. Homicide and accidents, treatable. Infant mortality, treatable. Preventable, I should say, preventable. Excuse me, I mean to say preventable. Secretary's Task Force, there were 60,000 excess deaths. This is 85, representing 47% of all deaths age 45 or less, 42% of all deaths age 70 or less. Now this one hits hard. At age 15, Blacks represent 15% of the population. By age 64, only 8%. One of the quotes that I do in one of my talks, when I talk, I mentioned that an African born in Harlem or in Chicago's South Side, 2/3 will not reach age 65. All right, here's Burden Clayton. My numbers say that Burden Clayton was saying now 2085 was 60,000. Now we're at 91,400 excess deaths per year, and they've increased 53%. Again, to buttress the great presentation of Dr. Randall, infant mortality is 2.2 times the white rate, worse than Cuba, Puerto Rico, Costa Rica. Now, I live in DC, and if we disaggregate what's going on in DC, Ward 7 and Ward 8, Anacostia. Anacostia is, by the way, where Frederick Douglass held court. Anacostia has worse health statistics than Mississippi, which is the worst in the country. And again, preventable. So the issue is, how do we get on top of this, ahead of this? Derek Bell, famous attorney, voices at the bottom of the well, silent covenants and confronting authority, has been quoted, I'm paraphrasing, it's as if they take out and shoot 100 brothers every weekend. I would encourage you all to read Derek Bell. He's an incredible resource. I know Dr. Randall knows him well. He's like one of the deans of African lawyers. Silent covenants is a sleeper. He didn't get a lot of play. He was in Silent Covenants. He was asking the question, what did we do right or wrong around the civil rights questions? And he said, when we were asking for separate, but when we were asking for equal or integration, he said we should have gone for equal and bump integration. And he said this many years after, but while folks were celebrating the 50th anniversary of civil rights legislation, nobody was paying attention to this book. Very interesting book. And a covenant basically is and I'm not a lawyer, but a covenant basically, like this from Dr. Randall's talk, a covenant is basically something that is like quiet and silent, but it's something that's agreed upon, let's put it that way. So like Dr. Randall said, when these issues come up and they can benefit white world, and by tangentially Black world benefits, then it's okay, we'll go for it. But if it's not making the world better for white world, it doesn't fly. From Ralph Ellison in Juneteenth. Juneteenth is a long piece of work, and Ralph Ellison's his last book. It's like, some of it is like a stream of consciousness. One of the lines is, the society is not likely to become free of racism. Thus, it is necessary for Negroes to free themselves by becoming their idea of what a free people should be. I encourage you all to check out Ralph Ellison. Juneteenth is long, but it's well worth it. The Man Not, I shared the cover of this book with Dr. McIntosh. This is a brother, Tommy J. Curry, and he talks about, I'm sorry about that, my bad. Oh man, I didn't mean to do that. Let me get out of this for a quick second and go back up here. Derek Bell. Okay, this is kind of like a hair trigger on this mouse. Tommy J. Curry, he has written a book called The Man Not, and he basically makes the case that many of the ideas that are attached to Black manhood need to seriously be challenged. And one of the things that he identifies in his book, we have arrived at a time of theory in which Black males are thought to be privileged, even as they are the overwhelming victims of various systems and bodies in society. So he's challenging a lot of the identity politics that goes on, and he's not been treated well. He can't get a job in the United States. I think he's working in Glasgow now. All right, so go some recommendations. I should be finishing up in a couple of moments. Marimba is on sovereignty real big right now, and I thought that maybe we could play with that and identify ways that we can empower ourselves. So the two synonyms that I found for sovereignty were dominion and independence. For dominion, rule, power, control, and dominance. For independence, autonomy, self-government, freedom, self-determination. I know a lot of us have been thinking about these things for a long time, especially during Kwanzaa time, Kujichagulia. So what is health sovereignty going to look like? Well, I'm saying we got to improve health literacy. Health literacy is important. I live in DC. Many people in Anacostia Ward 718 have a literacy problem. Some of the graduation rates have been 20%. That's even when they cook the books to graduate students. Some of the literacy problems go back generations. So there's a health literacy issue. And what I'm going after is that with so many of our people experiencing over a long time, so many common symptoms, diabetes, hypertension, strokes, things like that, we should have a better understanding of the pathophysiology of common diseases. That's on us that health practitioners can possibly share with communities and informs like health sovereignty. Again, we have the stress, diet, exercise, lifestyle. I know Dr. Hooker is very heavy into that. Dr. Gallman has been doing this for a long time. An anecdote about Tai Chi. I was walking through some Tai Chi steps while I was on the New York City subway platform, and a Chinese guy walked up to me and said, "Are you walking through some Tai?" I said, "Yeah, I'm doing some Tai Chi, just practicing." He says, "That's interesting, because when I was recovering in Taiwan from pneumonia, Tai Chi was part of my treatment plan." I said, "Oh." So now Dr. Chisel, who one of my mentors and his concept of optimal health, he would say to people who say, "I don't feel like exercise," and say, "Well, it's a part of your treatment plan. You got to exercise. You may not want to, but you got to get it in." Health sovereignty again. More community health forums with practitioners so that community members gain more trust. Again, trust of those healers making themselves available. And big ups to Dr. McIntosh and to Betty Dobson and CMOTEP and all the members of this forum. Health sovereignty, Saturday schools. What are Saturday schools? We were trying to do that in New York. I remember that Brother Diggs was trying to do that many years ago, and they haven't stopped. What are other schools? What do other communities do with Saturday schools? I'm talking about the Zionists. I'm talking about the Japanese, the Chinese, the Koreans, the Indians. They have their kids in school every Saturday, even for a half a day, to learn some math, some science, some culture from their perspective. So I'm saying, and I've had a couple of these episodes in my years where I've tried to sustain them. I've not been able to sustain them for a long time. Our longest one ran for about 6 semesters in DC. But Saturday schools with health components to decrease childhood illnesses with future implications like diabetes, hypertension, obesity. Michelle Obama, give her a shout out. She was working on childhood obesity. This is an artist named Michael Platt, who's a friend of my wife's, and he gave a conversation to a young artist. And Platt told the young artist, he said, and Platt was old at the time, 70. Platt said, older men have to live with decisions that younger men have made. And he was talking about some of the things that he had done that impacted his health in not too late a way. I'm gonna really take a quick break and show you some of Platt's work. Platt died, of course, because of not really having a great lifestyle and health. But Platt was a featured at American University. He was doing some work here coming out of some of the work that he had done in Australia. A couple of pieces of Platt's work. Platt was a genius with Photoshop and photography and painting. That was one of the people he had met in Australia. Platt was a geek. And again, it's kind of like, one of these people who still had a whole lot to give, like so many of us. So many of our people who have left too soon. Health sovereignty, again, political pressure locally and nationally. I think that Dr. Randall and Dr. McCurtis were mentioning that Medicare for all is obtainable, but like Martin Luther King's birthday, we had to fight for it like hell to get it. And in forming coalitions with other organizations fighting for the cause of optimal health for African families. I think the coalitions are going to be important. Health sovereignty, demand credentials and experience from healers. I always do this an anecdote. Gary Null has been on BAI for years, and he was like a host that was really talking about alternative medicine. And excuse me, one of my buddies took himself off all his blood pressure medicine and he stroked and died. So I'm of the notion that one should make sure that they can get the best of both worlds and make sure that your health practitioners have credentials and experience. Health sovereignties, meet with pastors and help them to help their congregations. Cooking classes for them could be happening inside the churches, shopping classes, challenging the concept of food deserts. Food deserts are places inside of communities where there are only like one grocery store servicing, you know, thousands and thousands of people. Anacostia had that for a long time. They're trying to work on that. I have a comment here from a pastor who I had in the clinic one day, and I was talking to him about, you know, his health. He was a diabetic, and he had self-admitted, or not self-admitted, he had to be taken to the ER 3 separate times because he was in diabetic coma. He was not taking care of his diabetes. He got it together. And I said, well, Pastor, why can't y'all pastors talk about diet and lifestyle from the pulpit? He told me one of his friends did that, and the following Sunday, half the congregation did not come back to church. So the diet thing is a very touchy kind of conversation. Brother Bay was one of our holistic health practitioners in DC, Kibwe Bay. He died from preventable prostate cancer. He was one of the people who identified, he informed Dr. Giselle and Dr. Dick Gregory into the notion of proper diet and lifestyle way back in the 70s. And anyway, Bay had a comment that identifies, he would be on the radio and he says, he said, you can have Sunday dinner, just not every meal. His other comment was that many of our women, they love their husbands, but the way they feed them, they are killing them. So some of this is diet, lifestyle stuff. Health sovereignty again. Connect and utilize emerging media platforms to advocate for healthy lifestyle choices for our people. And I added this one because we did an optimal health conference at Morgan State in 2014 about this. Rites of passage programs as vital for preparing our children for adulthood. These are vital pieces here, and I think we should be, you know, encouraging them and being a part of them. Health sovereignty, improving health messaging for high impact. That are culturally appropriate. Belafonte had said to me one time that, you know, when you are having messaging in our community about health, they clearly are not culturally appropriate. They don't even seem like they come from our people. And that's why they don't have high impact. Health sovereignty, transgenerational dialogues for sharing information in hopes of minimizing morbidity and mortality from preventable diseases. Transgenerational is the word here. Reaching the incarcerated, there's a huge amount of our brothers and sisters locked down for extended periods of time. And many of them, I think if I remember looking at the information from one of the organizations, I want to say the Incarceration Project, I'm blanking on the name right now, that's not it. But anyway, they said maybe 100,000 people in prison are there totally innocent. So we know that it's a mess. Minimizing self-destructive community violence and homicide in broken men, which is Frederick Douglass's comment. Frederick Douglass would say it's much easier to grow strong young men than to repair broken men. And I know any of us who have dealt in healthcare for a long time have seen that. AP DeBailey, a very dear friend of mine down here, started a program, a group of us called Positive Black Folks in Action. And he's always advocated we need a clearinghouse of information for our people, for information, the work that Dr. McIntosh is doing, and those who are developing websites and things like that, we should applaud, as Dr. Randall is also. Health sovereignty, establishment of self-funded think tanks locally and nationally that prioritize the health of our people and agitate, educate, and organize. And then we should strengthen existing and establish new networks. So these are some of the young people we had at the Saturday school. We have them learning CPR. This was like, I don't know, 2006 maybe. And the people who taught them CPR were sisters, women who were firefighters in the DC Department of Fire and Emergency Response. This is a brother who used to be in the office of the drug czar. He's a good brother. I can't recall his name. His first name is Donald. And this is a young Somali brother who was really a pistol, really a bright young man. But this brother here, his research was in drugs and their impact on pleasure centers. And he would be expert at taking MRIs of people after they took drugs and looking at the differences in some people's responses in their pleasure centers. Really good guy. This is a sister, Devine White. She's a neonatal nurse practitioner. She's probably got her PhD in nursing by now. She was talking about infant mortality and young people. This is my friend, Dr. Jules Harrell, a brilliant psychologist, was the first to start having courses in the Academy on Race and Racism. Here he's at a young lady doing some mental math, and it shows him when you do mental math, your blood pressure goes up. But he was just teaching them about blood pressure. And this is a dear friend of mine, Dr. Shamarka Keita. He's an anthropologist and a surgeon, and here he's doing some anthropology, some bone work with the young people. So I think that's all I got.
Okay. Thank you, Dr. Dr. Hunter, excuse me. Stop your screen share, if you will.
My people, my people, my people.
Okay, I'm admitting people in still. We've had up to 108 people in on this Zoom, and the information has been wonderful. Brother Keith, I mean, you have been doing some thinking, I mean, some comprehensive thinking around this stuff, and it helps people to have a whole context in which to put their decision making around health. If we were to ask you right now, should a person take the vaccine or not take the vaccine, what would your answer be?
I would say it's on a case-by-case basis. If the person is exposed to those who might make them unhealthy, they should have a long discussion with their primary care physician. We know that people who have a lot of comorbidities, existing conditions, are at risk. The elderly are at risk. And therefore, I don't have a yes, no. I have a get more information and make as wise a decision as possible. As one of my favorite surgeons in Atlanta would say, the research is going on right now.
Yes, you said it takes 6 or 7 years to get approval. So what should we do in that context? 7 years.
7 to 10.
7 to 10. Okay, so 7 to 10 years. What are we to think?
Well, I think that I want to recommend a documentary called Totally Under Control. Totally Under Control, and it's on Amazon. Might cost you $3 to rent it, but it actually identifies some of the behind the scenes mess that caused this country to have such a bad response. And the problem was that they dismantled structures inside of government purposely so that the responses would be fractured and fragmented and pretty much dysfunctional, like Steve Bannon had wanted the government to be dysfunctional. Apparently in that documentary, Johnson & Johnson was going to get the first nod, like my brother, Dr. Dason had told me. He was wary of Pfizer because they have lied and done stuff. He was also wary of Moderna because Moderna had never, ever brought a vaccine to market. So I'm saying all of that, there's enough reason to be concerned. And if we had any doubt about how Trump would function, if there was money involved, I guess I don't have to say the rest of what likely could have happened.
Okay. All right. Thank you. Listen, I have, we're going to hear from our other presenters. I have some housekeeping things to take care of. Ayikwe Ma said, all of life is twin, giving and receiving. Let he who would cast the spell of death separate the two. So if you don't want to cast the spell of death, please donate to CEMOTAP. We take no government funds. The only way we live is through you. Even though we can't meet at our headquarters now, we still have to pay all of the expenses connected to that, including property insurance, water bill, and gas bill, and things like that. So if you have, if you can, if everybody does it, nobody has to give a lot. I'm giving you 3 ways you can do it. I put it into the chat. I'm pasting into the chat. Last time I told you could give by check, by sending a check to 13505 Rockaway Boulevard, South Ozone Park, New York. Or you could donate by Cash App, and I gave you a Cash App, which was $ Dr. CEMOTAP. When I did that, people asked, well, what about PayPal? If you want to give by PayPal, I have a link to a GoFundMe right here. So you have 3 possible ways you could do it. And I wish you would select one of those ways. Whatever you do, I would like for you to put in the chat. You can send it just to me. You don't have to tell everybody else your business. Put it in the chat to me how much you're going to donate. And I want to let you know that our last program was a fundraiser for someone else. It was a fundraiser for Peace Health Center. Sister will be on with us today, Dr. Shadidi. I'm sure she'll be able to tell you how generous you were and how that generosity has affected her ability to maintain her clinic, the Peace Health Center. Now, what I'm asking you to do is donate to CEMOTAP. You can do it by Cash App at $ Dr. CEMOTAP, or you can do it by the link that I've established here for for GoFundMe, which will take you to, you can do it by PayPal, or you can do it by the old-fashioned way. Just write a check and mail it to CEMOTAP. Whatever you do, please let me know in the chat. I see, I've heard from, I'm not going to tell people's amounts, but I've heard from Brother Onaje. I've heard from Brother William Jones. I've heard from, let's see who this is right here. I can't make out the name, but the people are responding, and I'm asking you to please also respond. Don't cast the spell of death. Giving and receiving, all of life is twin. So listen, our next speaker is a brother. I made a slide in which I had a contrasted two people, and I had, well, are you going to be a Dibble or are you going to be a Delaney? Now, Dibble was a brother who had done things, good health things for our people, but then he ended up being involved with the Tuskegee experiment. He actually helped that to be, to be spread to his school and his students and his community. And there's a picture in the book Bad Blood with him standing there. So I have a picture of him on some slides I'll show you. And then we have the opposite, which is Dr. Delaney, Dr. Martin Delaney. I'll tell you why I consider those opposites a little bit later. But the fact of the matter is that any of us that are practicing in healthcare, whatever it is we do in our life, we have a chance to do Dr. Dibble type actions or Dr. Delaney type actions. Even Dr. Dibble had done Dr. Delaney type actions. You have to be very vigilant and hyper alert if you don't want to be the goat that leads the others to slaughter. So that's why we have a bunch of practitioners here who can tell us some things that will allow us to make an intelligent decision. So my last thing again is to say to give to CEMOTAP. Look in the chat so that you can see how. If you don't know how to use the chat, just look on the bottom of your page, hover over it with your cursor, and then click chat, and you'll be able to see. I've put them in the chat, the different ways you can do it, and many people are responding. I can see already. I thank you to Sister Malika Lumumba. I thank you to everybody that has said they donate. So without any further delay, let me bring on our next speaker, gastroenterologist, a race man, a member of the board of the Association for the Classical Study of African Civilization, or ASCAC. Please welcome, and I'll ask him, please unmute yourself, Dr. Goldman. Dr. Goldman, please unmute yourself. And thank you again, Dr. Hunter.
Thank you very much. I'm honored to be asked to participate again. And I'd like to give you and Sister Dawson the propers for bringing this information to a wide audience, because it's certainly needed. I did not prepare anything, but I want to react to what has been said. And I first want to mention that I followed Dr. Randall's work for a number of years, and she has done some extremely excellent work. I particularly like the way that she deals with health disparities and reparations. I think that those are some very, very important considerations that we really have to do that. I'd also like to raise Harriet Washington's work. She's written a book, and I don't have it in front of me right now,
A terrible, a
apartheid.
terrible thing to waste, environmental racism and its assault on the American mind.
Absolutely. That is a gem. That is a gem because we are faced not only with these health disparities, but then a lot of the health disparities that we face are due to our environment. So environmental racism is something that we really need to be involved in. Um, I can say I can't say too much about Doctors Bird and Clayton. Not only are they brilliant and have contributed, but they are an extremely gracious couple. And there's another researcher whose name I'd like to raise, and that's Dr. David Williams, who's done a lot of research and publications on the relationship of being Black in America and our health. Um, David R. Williams. There are a lot of others. I'll just stop right there. And one of the names that was mentioned just now, Dr. Jules Harrell wrote a book called Manichean Psychology, which I think gets to a point where we have to consider the state of our minds as it relates to our culture and our surroundings. We hear a lot about education. We hear a lot about politics. We hear a lot about economics. But if I can repeat something that Professor James Small told me that was told him by Dr. Asa Hilliard, education, politics, and economics will not matter if we don't win the culture war. So that we need to reacquaint ourselves with our culture. That being said, I'd like to move on to a concept called eugenics. I think Dr. Randall mentioned eugenics, and she mentioned some of the players of eugenics. Um, what is not known, and I read this some time ago, is that eugenics actually fueled the Tuskegee experiment because several of the doctors in charge of that Tuskegee experiment were graduates of the University of Virginia. And the University of Virginia had eugenics as a major part of its curriculum. So eugenics then was very, very dangerous pseudoscience, but it's even more dangerous now because if you read between the lines, we're getting back to a eugenically based approach to healthcare. And two of the names mentioned, Josiah Knott Clark and Marion Sims, who are both South Carolina natives. Being in South Carolina now, that is not a source of pride for me. And as a matter of fact, I applaud the citizens of New York for getting the statue of Marion Sims removed there because we still have a statue of Marion Sims in a very prominent position on the State House grounds, on the northwest corner of the State House grounds here in South Carolina, along with Pitchfork Ben Tillman and other notable races. With regard to the vaccination, I am not an anti-vaxxer because from an historical perspective, the concept of vaccination, and indeed the concept of quarantine of people with infectious diseases were uniquely African concepts. They were developed in Africa and brought here by the enslaved Africans. I think many people know the story of Onesimus, who was enslaved by Cotton Mather, who actually saved a lot of the white population of Boston during the smallpox epidemic in the 1700s. I think that that is something that bears repeating. We created the concept of vaccination, so we shouldn't be afraid of it. What we should do, though, is we should know as much as we can about the process so that we can be informed. To be an IUSA person in America, and I use IUSA to say African in the United States of America, to be an IUSA person in America and not to be somewhat paranoid is insane. What we have to do is to have an informed distrust. I think distrust is natural and necessary, but it should be informed. And it should be informed based on our history and based on whatever knowledge that we can get. Unfortunately, America is becoming anti-intellectual. You know, when we started study groups here, we were accused of being elitist because we were trying to learn. I think that it's very, very important that we all become elitist if that's what learning means, because you can never know too much, I don't think. I think that this whole idea of reparations as put forth in HR 40 for so many years by John Conyers is profoundly important and is intimately related to health disparities and is intimately related to what we can and should do. We should realize, as my brother Listerville Middleton said, that we are trapped behind enemy lines. So we have to create, we can't depend on the procedures and systems created by our enemies to save us. We have to create or recreate our own. I think that, let's see, there was something else that I wanted to say. Oh, with regard to vitamin D. Vitamin D is very, very important in building our immune system. Probably even more important than vitamin C, which gets most of the attention. The thing about vitamin C is that when you take a lot of it, you just end up urinating it out. So a lot of the vitamin C that we take doesn't really help us. Vitamin D is extremely important. And vitamin D metabolism is so important for so many things. Dr. Charles Finch in his book, Echoes of the Old Dark Land, has a chapter in which he talks about the effects of vitamin D. And vitamin D metabolism actually played a part in the emergence of the mutations that created the people we call white today, and during the Ice Age. So finally, with regard to the vaccine, I have not taken it yet. I do plan to take it, but like what has been said, I'm going to watch and wait. For me, it's too early. We don't know enough. When I do my research, every article that I read ends with something that says, we don't know for sure yet, but we just have to wait and see, and research is ongoing. So I want to wait until that ongoing research reaches some conclusions, and then I'm going to apply those conclusions to the information that I have based in our culture. And at that time, I'll make a decision as to the timing of my immunization. I'd be more than happy to try to answer any questions that anyone might have. Thank you.
Dr. Gorman.
Yes, sir.
You always so just wonderful. The combination of bringing the healthcare and the culture, you do it seamlessly, and it's really much appreciated. In terms of the people who have asked you your opinion, I know you got family, friends, patients. What do you tell them?
I can only tell them how I feel about myself. Um, and much like the answer that you gave, if there's someone who is at high risk based on their medical history, I will say, do all the research you can. And if you decide to take the vaccine, I will support it. I think that this COVID is a monster. In my family, we have lost a sizable number of relatives, close relatives, from COVID. So it's not something that I take lightly. What I become infuriated at is those people who don't take it seriously, who walk around with masks. You know, it's ironic that you have so many white folk that say that Black folks should not walk away from the police and that they're justified in shooting them in the back, but then they rail against being forced to wear a mask because it's impinging on their rights, on their freedom. I think that is mentally ill, but it's also a perfect example of white privilege. So that I encourage everyone who asks me that question to wear your mask, socially distance, do not go into a place. You know, one thing about going into restaurants, even if they are socially distancing, is the system of recirculation of air can also affect and carry the viral particles. So it's an individual thing, and I encourage everyone to know all they can know before they make the decision. And whatever decision they make, I generally will support.
Okay, Dr. Goldman,
Yes.
the two things. One, Dr. Hunter brought to my attention that you've written a document about the history of COVID that you keep developing as you go along, and he wants you to share it with our people. Could you paste into the chat a link or a way of getting in touch with you to ask for this document, or can you send it to me where I can distribute it to the people if it's available for distribution?
Yes, it is, and I'll be more than happy to send it to you.
And lastly, I want to ask you, when I was talking to you before about this vaccine, and we were talking about whether or not the messenger RNA could get inside of the nucleus, etc., you were explaining in a little more detail how different this vaccine is from others. If you're prepared to, could you tell us a little bit about this, how this mRNA vaccine differs from the old vaccines that people would get, and what are some of the new concerns we might have to have given the way that it operates?
Sure. Vaccinations, there are basically 4 types of vaccines up until now. There are live weakened viruses that are given, such as MMR, and such as smallpox, chickenpox. Those are weakened, what we call attenuated viruses, but they're live. And those vaccines are very, very potentially dangerous in people who have immunocompromised systems, like people with HIV or people who are post organ transplant and that type thing. Interestingly enough, though, there was some information a few months ago that suggested that the MMR, or the measles, mumps, rubella vaccine, play a part in helping people fight the COVID, the coronavirus, to the extent that there were, I think, I was told the University of Georgia, I think I remember them, uh, asked all their employees to take the MMR. This is before they came out with the Pfizer and the Moderna, and so that remains up in the air. I've not seen very much since then, but that remains up in the air. Another type of vaccine is the inactivated vaccine, which is kill viruses. These are not live viruses, but they're killed. And this is not as strong as with the live virus, but so you have to have booster shots. And examples are like hepatitis and flu and polio and so forth. There are recombinant vaccines that use part of the virus uh, to try to stimulate an immune response. And these can be used on people with immune systems, and they need booster shots, hepatitis B and HPV, whooping cough, and that type thing. Toxoid vaccines use a toxin that's produced by whatever the virus or bacteria is in order to create an immune response against that. So as you mentioned, the Pfizer and Moderna vaccines use messenger RNA, which is a genetic material that makes various proteins. And if you can picture the shape of the coronavirus, you know it has these spikes. And these spikes are made of the messenger RNA. And these spikes enable the virus to attach to our human cells to create the disease. So by injecting the messenger RNA, what the theory is that you stimulate your body, or you train your body to fight against messenger RNA, so that when your immune system is confronted with the coronavirus, it can successfully fight it off. There were some people who felt that this would change your DNA, but again, theoretically, according to what has been published, the messenger RNA does not enter the nucleus, so that it is not directly in contact with anything regarding the DNA, which is the primary genetic material. That exactly how that's going to work out remains to be seen, because again, we're early on, and the thing that gets me concerned is the fact that they developed this thing in 8-9 months, whereas, as mentioned, it can take anywhere between 7 to 10 years to come up with a vaccine. Now, the companies say that the time that was cut out was purely administrative, and that they took no shortcuts on the scientific development. What that says then is it gives a significant look at how they bloat their budgets of the R&D departments of these drug companies in order to make more money and inflate the budgets of the research and development departments of these drug companies, if that's true. Again, there are a lot of ifs, and that is one of the bases of my distrust, Professor Randall.
I got another follow-up question for Dr. Gorman. I know you get ready to.
I want to thank you again, Dr. Gorman. I have 2 more speakers to get in before 5 o'clock, and at that time we ought to be hearing from Dr. Lewis. So I'm going to ask our next speaker is a new speaker who's been added on. He is Dr. William Jones. He is a physiatrist, which is a rehab medicine physician, and he runs a clinic on Long Island. So I'm going to ask Dr. William Jones, I see he's already unmuted himself. Please introduce yourself and give your presentation or your response, Dr. Jones.
All right. I guess in our African tradition, I'd just like to ask for one of our elders to give me permission to speak.
You have permission to speak.
Thank you. I'm Dr. William Jones, as Brother James has just stated, and I have a clinic here on Long Island. With the advent of this COVID situation, it has, drawn the interest of, many in our community. Recently, I have been asked to evaluate a YouTube video that discussed the difference between African Americans and European Americans and how we may be affected by the vaccine. So since I initially saw that YouTube video, it was taken down. So by the time I had a chance to research some of the things that was said in the YouTube video and then go back having had more information, I wasn't able to reanalyze that YouTube video again. But I can tell you what I did find is that there was a research project done at in an Iowa university where they compared the African American and the European American gene expression patterns. Now, this paper is somewhat technical, and I don't want to get lost in the technicalities of the paper, so I'm just going to try to paraphrase it to a certain extent. As Brother Gallman had said earlier, on our cells, there are receptors, and those receptors are known as the ACE2 receptors. And those are the receptors that will recognize the spike protein that is in the membrane of the virus. And as Dr. Goldman has said earlier, our systems are trained to recognize that protein, and it goes through a whole biological process, which I want to try to spare us of at this moment. The significance of this particular paper is that they analyzed the receptors, the ACE2 receptors, in both lung tissue and esophageal tissue. And what they found was, in comparison to the European American versus the African American, is that there are up to 40 times more receptors in our cells than what you will find in the European American membrane cells, receptors. So that sounds to be a very significant difference. To keep it simple, the question would be, do we have anywhere genetic laboratories that are run by African-centered people where these type of things can be further analyzed so we can draw more definite conclusions? I mean, from what Professor Randall has told us, and so many of the other speakers today, it is only reasonable that we would be very hesitant to take this vaccine, knowing what our history is, in America. One other thing that I was thinking of when I was listening to Dr. Randall's presentation was that there's also there was a time when there was two brothers in California known as the who presented a paper known as the Strecker Memorandum. At that time, that was dealing with a a hepatitis B vaccine. But when they finished with drawing their conclusions, it looks like HIV was being spread by the application of the hepatitis B vaccine. I would just like to add that to the information that Dr. Randall had given us earlier. So I would leave it at that. And it's just further information for food for thought. Personally, myself, I don't plan on taking the vaccine. I'm doing the best that I can to keep myself out of situations where I would be overly exposed to the virus. I've been taking oregano oil, thyme oil, vitamin D, and vitamin C to fortify my immune system. And otherwise, as many of the other professionals have said, we will watch over the next 6 to 12 months to see which way this goes. Thank you.
Thank you so much, Dr. Jones. Yes, I remember that Strecker memorandum saying that it was an article. It was very similar to the article that had appeared on the front page of the London Times on May 11th, 1987, which said that the distribution of AIDS in Africa, that it corresponded to a smallpox vaccination program. The distribution is the states that had those, the African states that had that vaccination program were the states that had the highest amounts of AIDS that corresponded to the, and then the Strecker memorandum said that there was an hepatitis B vaccination program here in America where that same thing was true, that the distribution of where they had it. And it also made a correlation between the groups that the hepatitis vaccine was targeted towards were the same groups that at that time had the highest amount of HIV. I don't know what to make of it. I know that there was another paper, Who Murdered Africa, that also said the same thing. And I can't remember whether it was in the Strecker memorandum or the Who Murdered Africa, that was just pointing out that in those old type vaccines, the type that with the attenuated virus that Dr. Gorman was talking about, that because of the use of those in the past, that with the polio vaccine, some of them had been contaminated with something called SV40, simian virus 40. And I don't remember the percentage of people that are my age, they said, are walking around with that in our bloodstreams, and that it is correlated to a higher rate of brain cancer. So there are a lot of problems that people have with vaccines in general, but overall you have to take both sides, what vaccines have done to limit certain infectious rates, and then what they've done that harmed people. Now, another one that is very, that comes to mind has to do with the swine flu vaccine. It says that swine flu vaccine was pushed, but it never really culminated in a real swine flu vaccination epidemic as they were expecting. But yet, still, there were up to 500 people who took that came down with something called Guillain-Barré syndrome, which paralyzes you from the neck down. So, the horrors and the problems of vaccines, as well as what other people will allege are the benefits, That's the problem that we have. We're trying to evaluate how do we make an intelligent and informed decision, taking into consideration both the specific problems we've had with other types of vaccines and the fact that this type of vaccine is a whole new technology, I mean, relatively new technology that we don't have a whole lot of experience with, and certainly one for this COVID-19, as Dr. Hunter pointed out, as Dr. Gorman pointed out, as Dr. Randall pointed out, you know, it just hasn't really been tested that much. That in fact is being tested now, is what the situation is. So again, we always, I guess, come to the same thing, that it's a kind of an individual decision, that if you really feel you're at a high risk, you might have to, go ahead and take it. If you don't, you might come to another decision. So now our next practitioner that we're going to get in before Dr. Lewis comes in, Dr. Lewis, someone asked a question, what is in the vaccines? Well, Dr. Lewis specifically speaks to that, and we'll have him come on as soon as he gets here. He has something, he has to come a little bit late, but he's going to be here. But right now we have a health practitioner who is a doctor of acupuncture, and she runs a clinic called the Peace Health Center, where they have all kinds of things to help your health in general, other than just giving you medications, things that make a person better able to deal with stress, things that make a person better able to deal with even various psychological problems. And their emphasis is on an entirely different thing. Our last program that we had was, in fact, a fundraiser for the Peace Health Center. So I'm expecting Dr. Shadidi Kinsey to tell us basically her response to Dr. Randall's presentation, and also how effective was the fundraiser that we had for the Peace Health Center. Dr. Shadidi, would you unmute yourself and come on, please? Dr. Shadidi Kinsey?
Yes.
Okay, here you
All right. Habari Ghani
Jema Asante, Baragani.
and Chima Asante. I want to say Asante Sana to Simotap. And members and Sister Betty Dobson and Dr. James McIntosh for conducting this health forum on this vital issue that is affecting our community on this pandemic of COVID-19. And Asante Sana, because as Dr. McIntosh has pointed out, the past health forum that we had, it was a health forum, but it was also a fundraiser for Peace Health Center. And the power of organization, as President Kwame Nkrumah said, organization decides everything. And Simotap has been in the forefront and has pulled and keeps us together through the forums, through the participation of these offenses that have been against African people. And so with the fundraiser the past year, yeah, that was December. That was it was the past year, 2020. I had had been diagnosed with COVID-19 in November, and did the isolation. I didn't have severe symptoms, but the center had to be closed, and then in speaking to Dr. McIntosh, he initiated it with this fundraiser. So it was very Ujamaa cooperative economics, you know, of how Black folks, how we continue to rise. And it was extremely from that fundraiser, and I'm still receiving donations. And as of today, over $5,000 was raised from the fundraiser. So yes, let's give a la la, la 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 la. Yes, yes. So that's our power. That's our power of who we are as a people. As the Reverend Dr. Adam Clayton Powell spoke to us and said, "What's in your hands, Black people? What's in your hands? We got Black power." And when we initiate that power, and when we move on that power, and we work on that power, and we bring this to our people, it is always glorious. So we must always remain with this victorious consciousness that Dr. Molefe Asante advises us to do. Victorious consciousness, even with this pandemic of COVID-19. And the question is, and Dr. Randall, oh, Dr. Randall, oh, Asante Sana, for your life, for who you are, and the research and all that you've done, and documented and showing the effects of the injustices. I wouldn't even just say disparities, I would say injustices that is done on a daily basis to Black people. And so then we move on that, and we will rise. We will rise from this, as continuously we have from our past, and being here on the shores of North America, from the Holocaust of enslavement until now, still we rise. The question is Black distrust during COVID-19 pandemic healthy or unhealthy? It is historic. Some would say distrust, but we always move with caution. We know America. We're here in the belly of the beast. So in being in the belly, we know the beast. And from the injustices that has come through, because oftentimes we talk about the politics of this, that, education, and all. Very seldom do we talk about the politics of health and what that has done to us. So on behalf of myself, Shadidi, Mama, Dr. B. Kinsey, the executive director of Peace Health Center. I'm a member of the family and friends of Dr. Montulu Shakur, Mayim Wali, who is a prisoner of war. And after 34 years in captivity, they still refuse to give him a compassionate release. And Dr. Shakur has multiple myeloma. And
Bone marrow cancer.
Yes, bone marrow cancer. And he was stricken with COVID, and he's coming along good. He's coming along because Montulu's spirit, that African spirit. And I'm also the vice chair of New York NACO, the National Association of Kawida Organizations. And our national chair is Dr. Maulana Kareem. We say Karibu, welcome. You have found your family in a peaceful place. Wish blessings without number and all good things without end. And we bear witness as an African people, as our beginning was great and good, so shall our development be throughout eternity, if we dare to speak truth, do justice, and walk in the way of rightness. Ashe. Peace Health Center. Dr. Randall had spoke about with the, and others have alluded to this, where we find ourselves, where we can go, where we have these venues, the practitioners, the health facilities that that address our need as African people. And so since 1990, we are celebrating 31 years, 31 years of bringing this healing to our community. And we're at Peace Health Center, we put the Nguzo Saba into practice. And these principles are Umoja for unity, Uji Chagalia, self-determination, Ujima, collective work and responsibility, Ujamaa, cooperative economics, Nia, purpose, Kaumba, creativity, and Imani, faith. How do we deal with this? With this COVID-19 in these troubled times? And these are troubled times. Education, education for our people. And in fact, peace, that's what the acronym is. Positive, we borrowed that from the 5 percenters, the nations of gods and earths. Positive education always corrects errors. We follow the protocols, the wearing the mask, the personal distance, not social, personal. You know, we need to be as social as possible, washing the hands. And we keep striving and struggling, because this is life and death, and we choose life. We open up to life, to reach out to others. I advise our patients, you know, of reaching out to others, being in contact with one another, letting us hear from one another, checking on one another. You know, don't close down. That is very detrimental. You know, while we're in and play music, dance, you know, the healing dance with that does. Exercise. If you don't have, you can go on YouTube and get different exercises. And I strongly advise the Qigong, because that deals with the breath, with the Qigong. And we force ourselves to be free. Reject death. Reject the despair. No, it ain't about wasting away and getting into that way of thinking. It's about being African. Our forebears went through, as Dr. McIntosh always said when we speak, he says that Harriet Tubman prayed for our worst day. Understand that? So here at Peace, with Umoja, with Unity, our practitioners, we have complementary medicine, not alternative. It's not one or the other. We can blend it all. And this is very important, because Dr. Hunter spoke about people stopping their, a friend of his stopped taking his hypertension medicine. No. No, we can have complementary medicine, and that's what we have here. And our practitioners with the acupuncture, with the naturopathic therapy, the nutritional counseling, the herbal recommendations, iridology, and all, with the naturopathic services. The massage, we have a massage therapist who is a massage, and don't we need that with all the stress that we're under? We also have Reiki. So all of these is moving the energy, balancing the energy. At peace with Kuji Chagalia for self-determination, we continue the work of Banner, the Black acupuncturist Advisory Association in North America. And bring this healing to our medically underserved community. We do it with health seminars and workshops and open house, and we had live jazz, you know, what the music does, the DJ, dancing, food, all of this with Kuji chocolate, that's self-determination. Ujima for collective work and responsibility. We are in a health crisis. Pre-COVID-19. Pre-COVID-19, the Congressional Black Caucus Research Foundation, and this was in 2003, of its report on the leading causes of death in the United States of America. African Americans led in 11 categories. At that time, now it's probably higher. And what was the response of the government? To close hospitals. To, again, with the injustices, to reduce, to close. Hospitals have been closed during this pandemic and in our community. And before that, so with these health disparities, and so we here with Ojima, with these, with our, to make our brothers and sisters' problems our problems, and then we solve them together. Ujamaa, we put into practice for cooperative economics. We don't receive any government funds. As I said, it is Black people's support that has kept us here for 31 years. So Ujamaa, and we have truly affordable fees. You know, we even have a sliding scale because not everybody can afford that. And so we have to take all of that into account. Nia, our purpose, to make our collective vocation the building and development of our community in order to restore our people to their traditional greatness. Nia, that's our purpose, y'all. Kuumba, for creativity. As an injured physician, we go to ancient Kemet with Saruj Ta for our people to repair that which is damaged, to restore that which is in disrepair, to replenish that which is depleted, strengthen the weakened, and giving a ladder to those that are stuck in the pit of despair. Kuumba, creativity, and Imani, faith. Faith in ourselves. You know, that faith sustains us. It gets us through. It enables us to make a way out of no way. Keep the faith. Again, the Reverend Dr. Adam Clayton Powell Jr., what did he advise us to do? Keep the faith, baby. And that's what we do. And acupuncture, how it works. It works on the premise of balancing the body's energy. According to Chinese medicine, everything functions through energy. The cause of any disharmony is a result of the imbalance of the body's energy. And through adjustment with the acupuncture, the quality of energy can be improved and be made to flow smoother. Acupuncture is very useful in cases of disorders of weakness and pain, even when these conditions come from past illnesses, injury, physical or emotional. This is key with the emotional stress. Again, Dr. Randall spoke about intergenerational stress and what these injustices and how it can be traced. So the emotions. So acupuncture works on those levels: the physical, the emotional, and then also the spiritual. Okay. And as Dr. Karenga had advised, we're combating two viruses, the COVID-19 pandemic and also the pandemic of the pathology of oppression. What does oppression do to our emotions on a daily basis? I mean, we got COVID-19, and then in our neighborhood, in Bedford-Stuyvesant, we got gentrification. What does that do? So this oppression, how it works on the emotions and the spirit, you know, where fear and anxiety injure the kidney energy. Intergenerational. We come from the Holocaust of enslavement to present day with this fear. You step outside, you driving while you black, you got shut down. You walking while you black, you get shut down. You know, so what does this fear do to us? With the hypertension, with all, it affects that. So with the acupuncture, we can balance it out. You know, the anger and the rage, how that affects the liver energy. Okay. The worry and the isolation. What are we doing now? The isolation. That affects the stomach and the spleen. That also reduces the immune system. That worrying, that constantly worrying. The grief, how it attacks the lungs. Look at what this COVID-19 has done. We can't even give our loved ones, those who are deceased, proper burials, the homegoing services. What that was to reinforce us. Now we got to Zoom it. You know, we can't embrace one another. So that grief, how it affects the emotions, which affects our health and our well-being. Okay. And so with these immune system deficiencies, the respiratory disorders, the allergies, uh, the gastrointestinal disorders, all of this, that it will be the acupuncture and this natural healing will be a benefit. Also, we have the and where we live, this harm, because we're exposed to this the toxins. We live in toxic zones, from Cancer Alley in New Orleans to Asthma Trail in New York City. Toxic zones. This is where we're located. So again, is that we're not going to disperse it all, but having our patients aware and educated of what is occurring. Okay. In conclusion, I would like to say that Peace Health Center is celebrating 31 years of struggle, service, healing, and may we continue, y'all, to have a victorious consciousness, as Dr. Molefe Asante advises. And children, don't you get weary, because Kawita has brought me so far. I'm no ways tired. Kawita has brought me so far from where I started from. Nobody told me that the roads would be easy, but Obatala did not bring me this far to leave me. In closing, Dr. Maulana Karenga teaches us to hold ourselves accountable and take rightful responsibility for our lives and the world in which we live. We must continue to struggle, keep the faith, hold the line, love our people and each other, seek and speak truth, do and demand justice, be constantly concerned with the well-being of the world and all in it, and rebuild the overarching movement that prefigures and makes possible the renewed, new, good world we all want and deserve to live in, as a legacy for those who come after. Asante Sana, and thank you for the time, Simotep, Dr. McIntosh, Betty Dobson, and to Black people. Asante Sana.
And Siki too. Thank you, Dr. Shadidi. And we're so glad that the Peace Health Center is on a stronger footing now. And we're glad to have your that community resource to stay in our community. We appreciate you. Right now, we are awaiting Dr. Lewis, and I have a number of announcements to make. I'm going to try to do the screen share. A long time, we're going to have a forensic psychiatrist named Dr. Barbara Justice. And many of you are saying, hey, no, Dr. Justice is a surgeon. Well, I hope we don't have to use up too much time when she comes, but Dr. Justice has added to her training. And now she's not only a board certified psychiatrist, but a board certified forensic psychiatrist. And she's going to be talking about self-help for anxiety during COVID. That's on February the 3rd at 2 p.m. on WBAI. After that, on the 10th, we're going to have Bernard Creamer, who's the author of a book called Who Stole the Soul? The Weaponization of Hip Hop. And the question is the music murdering our minds and our youth? So let's make sure that you are all hearing this. I'm going to stop the share for a second. Change the view to the gallery view. If you were hearing what I was saying, could you raise your hand? Okay, great. So I'm going to go on with announcements. The announcement is a radio program. So you can take a look at that, read it for yourself, some of the first programs we have, but we're going to be talking about Dr. Amos Wilson. We're going to be talking about Dr. Francis Wilson. We're going to have people like Dr. Adelaide Sanford and others. And we will begin on February the 3rd. Of course, we'll be wanting you to call in and to write in and tell people how much you're enjoying it, if you're enjoying it. And understand that our program today is not over. We still have Dr. Lewis, who's going to be coming and speaking to us. But I'm going to go back to the screen share and go through a few things. Right, so you see we're going to have Brother Raymond Duguay. He's here today, and he's going to be talking about the psychology of Amos Wilson. A lot of people don't know that Dr. Wilson consciously decided to develop a psychology based on the teachings of the Honorable Marcus Garvey. And so we have one of the foremost experts on Marcus Garvey, Dr. Raymond Duguay, who will be here. And Anthony Browder is a part of a group of people that have done a collection of works on Dr. Francis Wilson, basically remembering her and going through her contributions. And he's going to be there to talk to us about the media and the shaping of the mind. That'll be all the way in March 10th. We have programs going at least for the next 12 weeks. So now let's move on here. We have to do something to say. Screen share. We have a Zoom next month on February 27th. We have a Zoom that features Dr. Shango Blake, educator, hip hop activist, and president of Black Edfluences United. Many of us know him as the son also of Dr. Bessie Blake and Dr. James Blake. And we have Nana Camille Yarborough, award-winning artist and author and cultural activist and Rio. And we're going to have Dr. Ray Winbish. He's another one of the scholars who contributed to that work about Dr. Francis Wilson called the Osiris Papers, along with Dr. Browder and others. And he's also the author of The Warrior Method. And Sister Joyce Jones, who has a program on WBAI called Sugar in My Bowl. We have Kwabena Siddiqui Jijaga Rasuli, who in addition to being the nephew of Geronimo Pratt, is a organizer trying to do something about the murderous lyrics that are on the radio and some hip hop music, and that he's linking to the murder epidemics that are taking place in many of the urban centers in the country. We also have Sister Erica Ford, a sister who's on the ground in the anti-violence movement, the co-founder of Life Camp Incorporated, and Bernard Creamer, who I already told you is the author of Who Stole the Soul, the Weaponization of Hip Hop. And we have Sister Betty Dobson, who struggled on this issue for many, many years. That's going to be on the 27th of February, which is a Saturday at 2 p.m. Again, you must RSVP. So you RSVP the same way you did this time. Now, the issue is reasons for Black distrust. And I think some of the reasons are the way that African people have been treated in general. In other words, it doesn't have to be only the way we've been mistreated in health for Black people to mistrust health care system and health care practitioners and a system that's controlled mainly by white people. The treatment that white people have given Black people since we were kidnapped and brought here is enough to make our people distrustful. And we have things that white scientists have said about us and done to us. We have the way our scientists have been treated, the way our physicians have been used and abused, and then what our physicians have told us, what white folks have said about themselves. And then, of course, we have the financial and corporate connections between people suspected to want to hurt us and the pharmaceutical industry. Now, this is not me. This is the London Times that tells you that in the past, there have been suspicions that have been raised by some of the vaccination programs. This was the London Times, May 11th, 1987. And it asked the question, did the smallpox vaccine trigger the AIDS virus? I don't know the answer to that, but if the London Times is asking it, you know I would have to be suspicious about a brand new vaccination program. It's been said we've made the greatest contributions to medical science in the history of mankind. Unfortunately, most of it against our will. This is a testament to a situation where they found over 7,000 amputated, dissected bones of aspirins in the basement of a school. I believe it was the Medical College of Georgia in Augusta. And that was in 1989. And you can learn all about that in a book called Bones in the Basement by Robert Blakely. We noted on the House of the Virginia House of Delegates that one of the delegates asked a question. He was asking the question basically sarcastically because he was saying that these other people would do the things that he's saying. He said, sir, we have as far as possible closed every avenue by which light may enter their minds, talking about Black people. We have only to go one step farther to extinguish the capacity to see the light, and our work would be completed. They would then be reduced to the level with the beast of the field, and we should be safe. And I'm not certain that we would not do it if we could find out the necessary process, and that under the plea of necessity. In other words, they're going to say that whatever they do is necessary. We got to do it because of this reason or that reason, but really the purpose is going to be to actually just shut our minds down, reduce us to the beast of the field. Now, some people say that people didn't mean some of the things they say. We have Margaret Sanger, who talked about, we do not want word to go out that we want to exterminate the Negro population. This is the mother of Planned Parenthood. And so that's what she said. We want to know, what did she mean? Well, maybe in another one, a couple of her quotes, we can get an idea. She said, the mass of Negroes, particularly in the South, still breed carelessly and disastrously, with the result that the increase among Negroes, even more than among whites, is from that portion of the population least intelligent and fit and least able to rear children properly. That's from a book by a woman named Linda Gordon. Then we have charity. This is what she said about charity. It encourages the healthier, more normal sections of the world to shoulder the burden of unthinking and indiscriminate fecundity of others, which brings with it, as I think the reader must agree, a dead weight. She's talking about the fertility, a dead weight of human waste. Instead of decreasing and aiming to eliminate the stocks that are most detrimental to the future of the race and the world, it tends to render them to a menacing degree dominant. That's Margaret Sanger. Now, here's a quote that they attribute to Bill Gates. And of course, the system has found a way to, when these types of things leak out, to debunk it. They'll give you something to say, well, is it a myth or is it real? And then they'll tell you why not. So I'm going to give you both sides. The quote is, the world has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 to 15%. Now, that is attributed to Bill Gates. All right. And so here's a defender. He says, in fact, the founder of Microsoft speaks about slowing population growth rather than reduction of the population. This was also confirmed by the famous fact-checking platforms PolitiFact and Snopes. See, that's what we're supposed to go to find out if something's a myth or not. That are fake stories on the issue. Gates notes that vaccines are crucial for reduction of child mortality in the developing countries, which for its part will slow population growth, according to Bill Gates. More specifically, Bill Gates thinks that when more children survive, parents will choose to have fewer children. So you take your pick as to which one of those you think that Bill Gates meant, and then you can go back and check his involvement or his association with the development of some type of COVID virus. Not this one, but some sort of COVID virus. Right here, I mentioned to you last week, and it's worthy of replaying. This is Dr. Fuller, a virologist who is a professor, a college professor, and she is on the panel of the FDA that had to approve this thing for this emergency use. Now, I understand her for yourself. Now, the way I place a person in this kind of position is that these are people who are really fully in the system. They've been given the keys to the castle. When they're able to say approve things or not approve things for the FDA, that's one of the keys to the kingdom. So I had a friend named Shaka, and he said he had a dog. When he and that dog were out in the woods, he said that dog wouldn't just leave him if something dangerous came about. He said that dog would one time look back at him and look him in his eyes. And when that dog looked him in the eyes, that meant to run. He said if he didn't run, then it was going to be too bad on him because that dog was getting ready to run. So, I mean, I'm only making an analogy to say that when we have insiders, we gotta read between the lines. We gotta, if a black person winks at us, we gotta take a look at that. During the Jim Crow period, this is 1916. This isn't during slavery. This is a story about a man named Washington who was a mentally retarded teen, and he was accused of murdering a white woman. A white woman was murdered, and they grabbed him, and they beat him and dragged him to a suspension bridge spanning the Brazos River. Thousands roared, burn him. Bonfire preparations were already underway in the public square where Washington was beaten with shovels and bricks. 15,000 men, women, and children packed the square. They climbed up poles and onto the tops of cars hung from windows and sat on each other's shoulders. Children were lifted by their parents into the air. Washington was castrated and his ears were cut off. A tree supported the iron chain that lifted him above the fire of boxes and sticks. Wailing, the boy attempted to climb the skillet-hot chain. For this, the men cut off his fingers. The executioners repeatedly lowered the boy into the flames and hoisted him out again. With each repetition, a mighty shout was raised. If you want to know what it looks like for 15,000 people to watch such a thing to happen, there it is right there. That's a picture of it. These are picture of various things that have happened to us. Some of them have to do with medicine, some that don't. This middle one with the little child by a crib, he was one of the youngsters they call the guinea pig children here in New York. They had a couple of these centers, these ACS centers, and the children were being given AIDS drugs, even though some of them didn't have AIDS. And one of the nurses adopted one or two of the children, and at a certain point, she recognized that what was giving them the medicine was one of the things that made them sick. She stopped, the children got better. What did they do? They removed the child, removed the children from her care because of so-called medical neglect, because she wasn't giving them these medications that she saw were hurting the children. BBC had to report this. This wasn't reported in American media. On the left, we see the survivors of the Tuskegee experiment under Bill Clinton, all in wheelchairs. Here we see up in Boston, this is someone using the American flag. And believe me, if this same gentleman had been caught on the steps of the Capitol just last week, he probably would have met the same fate. And of course, we have this famous picture down on the bottom. This is the doctor that Dr. Randall spoke about. This was J. Marion Sims, the inventor of the speculum, the so-called father of obstetrics and gynecology. And this is one of his victims / patients, Lucy, a woman that he owned, did dozens of surgeries on. And of course, it's all made to look clean and pristine, as Harriet Washington said in her book. And then Harriet Washington describes what the scene was actually like, while this man, who was by the way, was a head of the American Medical Association at a certain point, and who there's statues to in New York and other urban centers. I just want to point out to you, does anybody know where this picture was until probably about until about 2007? It was at Pfizer. Okay, now these are pictures here of the people who supposedly were being studied for the natural course of syphilis, and yet we have them giving accounts of having gotten vitamin injections. Why would you give vitamin injections to somebody that you're trying to do a study of the natural course of syphilis? You don't want to interfere with that at all. And yet, although these people did these things, some of them lived to go on and repeat the experiment down in Central America. And in Central America, we do know that they did inject the people with syphilis. And this over here is a picture of prisoners who were given radiation and operated on, with their consent. But again, they were in the same condition as Lucy. They were in a state of slavery. Now, there's no punishment for the medical crimes these people commit. Here's Dr. John Rod Heller. He went on. He became the head of the so-called venereal diseases section of the United States Public Health Service. He then went on to become the director of the National Cancer Institute. And from there, he went to Sloan Kettering. I mean, these are people that had successful, happy careers despite having been involved with this atrocity called the Tuskegee experiment. And Heller is not an exception. In fact, the person who was the head of the venereal diseases section during the Tuskegee experiment in 1969 was a person by the name of David Sensor. David Sensor held the meeting, which was the infamous meeting, which was to determine if the Tuskegee experiment should still continue to go on, despite the fact that we had modern antibiotics and that syphilis was totally curable. And of course, they voted to continue it. The Tuskegee experiment did not end until 1972, when it hit the press and people like Ted Kennedy and so forth brought it to the fore. And he didn't get punished for that. In fact, after that, he became the head of the CDC in its entirety. And even then, when they conducted the swine flu vaccination program, he wasn't punished for that either. These guys, when they get punished, they get bumped up. From there, he left, and most of you don't know where he eventually came. By 1981, he was the Commissioner of Health of New York City. So there's plenty of basis for distrust. I don't know what to tell you to do with that distrust, because we are in a situation where, we don't have a whole lot of options. this is a person who did get punished. This was Henry Forster. Most of us know of someone else being the first Black person as the Surgeon General, but and she also got punished at a certain point. But this gentleman was slated to be the Surgeon General, but he didn't make it through the process because they accused him of being at that meeting. He denied to this day that he was ever at that meeting that made that decision. Spencer went on to become the Commissioner of Health. He was not permitted to be the Surgeon General. And I'm not saying he should have been permitted to be the Surgeon General, because I had the experience of going to a lecture by James Jones, the person who wrote the book Bad Blood, which is about the Tuskegee experiment. He was at Downstate Hospital, and I went over there. I listened to the lecture, and people asked questions, and I raised my hand and I asked them, I said, do you think that Henry Forster had any culpability in the Tuskegee experiment? And that man stood, he hung his head, and he said, that's the question I had dreaded somebody would ask. And he explained how Henry Forster was the head of the National Medical Association down in that area, down in the area of Macon, Alabama. And he said that, or Macon County, he said that a part of the experiment, which most people don't even know anything about, is that it was not enough just to not treat these men. What they did was ensure that these men got no treatment anywhere for anything that required antibiotics. And the only way to do that was to do that through the medical societies, and to do it where every practitioner in the area knew not to give any of those men antibiotics, even if they came down with pneumonia or came down with something else that was easily treatable by the antibiotics that were available. And they say if you want to hide something from Black people, where do you put it? You put it in the book. They published at least 13 papers on what they were doing. And what Jones said is that there's no way that Henry Forster could have been the head of the National Medical Association down there and not known about that particular agreement that had to be made by all the practitioners. I also said that one of the reasons for Black distrust is the way they've treated our scientists. Here we have Granville Woods, the man with whom there would be no Coney Island, there would be no subway, no third rail, that sort of thing. And we had him having to go to patent court to fight with Edison. On one occasion he won, on one occasion he lost, and on another occasion they figured how to get him to stop from complaining about people stealing his invention. So Woods had created something which allows you to see where the train is during the during its route, from the station, from the allows a dispatcher. So Woods was greatly heralded for this invention, but he received even less renown when Thomas Edison and another inventor, Lucius Phelps, challenged Woods' rights to the patent, claiming in separate legal suits that they had each developed a similar telegraph system before Woods. In both cases, Woods was declared the prior inventor. Now, Dr. Jeffries has told us how that comes about. It turns out that Woods had made a model of what he had, because these are white courts, white judges, so on and so forth. You have very little chance of winning anyway, but Woods had made a model of his invention, and he demonstrated his model. So the judge asked Edison if he had a model, and Edison said, yeah, I got a model. What else was he going to say? But I left it at home. So they allowed him to go home and try to come up with something. He came back the next day, and his didn't work, so Woods won. But they don't stop there. The system that we have the distrust in is relentless. In 1892, they did it a different way. When another one of his inventions, he said, was stolen, he accused the manager of American Engineering Company of stealing it, his patent for an electric railway. When he couldn't post the bail, they jailed him. So in other words, this is the way that they've treated this is Garrett Morgan, great inventor, invented the three-way stop sign, a bunch of things, that the gas mask, all these things. He had to call himself Big Chief Mason, pretend he was an Indian in order to go around and sell his products and do the work that he had to do. We have this guy who, let's see, who's this? This is Matzinger. Yeah, he made the shoe lasting machine. To put the top of the shoe to the bottom of the shoe automatically. That had never been done. It couldn't be done. At any rate, he would be getting money from every shoe that was made, even to this day. But instead, he got a total of $15,000. There are others. I won't go through all of them. Certainly, oh boy, there's people waiting in the waiting room. Let's see if we can make them in. But if I do that, that's going to stop this presentation. So I'm just going to do a couple of more slides and then I'm out. These slides that I'm going through, here's Edison. Here's the irony of Edison. How did they treat our scientists? Edison was working for the Edison Light Company as an engineer and as a draftsman and legal expert. So his intelligence was known by Thomas Edison. And this is Latimer's patent for the lamp, for the bulb, the lamp, the light bulb. What did they do with that light bulb? They put it in a screen projector, and these are the types of movies that Thomas Edison made, even though he had fought Granville Woods in patent court, had Edison working at the Edison company. He was making movies that were displaying us like this. Movies such as The Wooing and Wedding of a Coon and A Nigger in a Woodpile. Steve Biko said that the most powerful weapon in the hands of the oppressor is the mind of the oppressed. I've been using this slide for, it seems like, I guess, almost a decade now. And it's just, we're so happy that we had Dr. Randall here today with us. Harriet Washington, of course. This is Jocelyn Elders. Remember that she's the one that said that they asked her, did she think masturbation would be helpful in terms of slowing down AIDS? And she was saying, well, it would be, it could be, it would certainly cut down on sex that people were having that was, and it could be where they can infect others. And they thought that was very, very lewd. And I'm going to end on that. This is Francis Wilson said, if you don't understand racism, if you don't understand white supremacy, everything else you understand will only serve to confuse you. These are just more abuses. This is the guy that perfected his technique of laparotomy on ovarian tumors by, with people that he owned. This is Walter Jones, who he had an idea, hey, I think I could stop typhoid pneumonia if I pour 5 gallons of boiling water on the spinal column. And you know who he did it to? He did it to enslaved African people. That's J. Marion Sims. Is he a person that was living in ignominy? No, this is what it said. It's called him surgeon and philanthropist, founder of the Women's Hospital, State of New York. His brilliant achievement carried the fame of American surgery throughout the world. What our brother Wade Noble said is that power is the ability to define reality and have others respond to it as if it were their own. That's not certainly our reality about J. Marion Sims, but they have the power to make us think those things. So this is Dibble, this is Delaney. These are 2 different types of Black practitioners. The type of practitioners I tried to have on this panel today are of the Delaney type. They're not the type to lead us down a bad road. I trust the things that they say. And of course, all of them have told us we've got to make an individual decision, but we have to get the facts before we do so. The last thing I'll say to talk about this Delaney type of physician, I want to tell you Delaney's response when he was asked by a mayor regarding his opinion on the Fugitive Slave Act. The Fugitive Slave Act, anybody who came into contact with a fugitive slave was bound to the punishments. And what Delaney said was, Honorable Mayor, whatever ideas of liberty I may have, I have received from reading the lives of your revolutionary fathers. I have therein learned that a man has a right to defend his castle with his life, even unto the taking of life. Sir, my house is my castle. In that castle are none but my wife and my children, as free as the angels of heaven and whose liberty is as sacred as the pillars of God. If any man approaches that house in search of a slave, I care not who he may be, whether constable or sheriff, magistrate, or even judge of the Supreme Court. Nay, let it be he who sanctioned this act to become a law. That's President Millard Fillmore, surrounded by his cabinet as his bodyguard, with the Declaration of Independence waving above his head as his banner, and the Constitution of his country upon his breast as his shield. If he crosses the threshold of my door, and I do not lay him a lifeless corpse at my feet, I hope the grave may refuse my body a resting place, and righteous heaven my spirit a home. Oh no, he cannot enter that house, and we both live. So,
book at this time. In your new book, Long Time Coming, you trace the history of racism in America and address many victims of systemic racism and police brutality.
we're going to admit these people in, and then we're going to mute whoever that is.
What inspired you to write a book that takes this deep dive into what is America's original sin?
I guess somebody didn't like our form. They want us to listen to what they want us to listen to. Let's see if we can mute. I know they're going to be tough.
After the death of George Floyd and Breonna Taylor and Ahmaud Arbery, to really reflect on.
Bear with me until I find this person. Okay, I found it. All right, brothers and sisters, in that period of time, Dr. Lewis has come, and he's going to be our final speaker. Dr. Lewis, can you unmute yourself? Dr. Lewis, I thought I heard his voice. Maybe. Dr. Lewis?
Can you hear me?
Yes, sir, we can hear you now. So I'm going to get out of the way. I'm going to give you the speaker's view where everyone can see you. And floor is yours.
Okay. Okay, good evening, my fellow African. My name is Dr. Arthur Lewis, and I'm one of the African physicians that practice in New York City. And I'd like to extend my appreciation to Dr. McIntosh and all those who have put together this seminar, and all of the contributing physicians and non-physicians trying to and doing a good job in giving us information. My contribution to this seminar and knowledge base is going to be, in about 15 minutes, I'm going to read some material that I have put together as it relates to the virus and as it relates to the response of this virus by the US government. So I'm going to begin to read to you what I have here. It should take about 15 minutes. There's a new book that has been published about August 2020, and it is called Capitalism on a Ventilator: The Impact of COVID-19 in China and the US. An anthology of social justice activists discussing a global choice: cooperation versus competition. Edited by Sarah Flounders and Lee Soo-hin, a project of the International Action Center and Chinese-US Solidarity Network. So I will begin to read for you from about 4 or 5 of the pages, and should take me about 10 or 15 minutes. Unfolding Crisis: It Doesn't Have to Be This Way, by Sarah Flounders, August 1, 2020, iacenter.org. The United States is reeling from a triple crisis: the COVID-19 pandemic that has inflicted over 4.1 million confirmed cases and more than 150,000 deaths since the end of February, the most of any country in the world. Beyond this pain and suffering and death, over 1 million workers a week have filed for unemployment ever since April. In the face of shocking instances of police murder, millions of people all over the country, in big cities and small, remote and rural towns, have marched and protest racism and systemic abuse of police power. Facing multiple catastrophes, the US authorities sought someone to blame. Since COVID-19 was first identified in China, politicians of all stripes in the US have assigned the blame for the COVID-19 to China and added a worldwide confrontation to the political and economic scene. No days go by without the United States corporate media promoting totally distorted and negative news, attacks on the peoples of the Republic of China. The book is a joint project by China and US Solidarity Network and International Action Centers. Since this book report the casualties of a rapidly escalating global pandemic over months, which chapters organized by dates within each month. We continue. Due to the growing hostility of the US establishment towards China and the accompanying surge in an anti-Asian racism, it was an enormous challenge to find printing and distribution for this anthology, which includes many published authors. Amazon block of this book is a clear example of US corporate censorship. We were notified due to the rapidly changing nature of information around COVID virus. We are referring customers to official sources for advice about the prevention and treatment of the virus. Amazon reserves the right to determine what contents we offer according to our content guideline. Your book does not comply with our guidance. As a result, we are not offering your book for sale. An anthology described to a magic cure. We go on. I'm quoting from the book. The COVID-19 pandemic puts the contention between the US and China in sharp relief. The relentless drive of capitalism to reap a profit from every type of human interaction now stands exposed as the greater danger to the people of the whole planet. US capitalism has no effective way of resolving the COVID-19 pandemic, even within its borders. This failure is a public humiliation. Washington is also incapable of offering leadership to its imperial allies or to those developing countries it hopes to dominate. The narrow for-profit constraints of capitalism, the absolute need to maximize profit in order for the system to survive makes global cooperation impossible and threatens the US hegemony. Within the US, the largest capitalist economic crisis in 90 years has shut down the industries and services, leaving nearly 30 million, one of 5 workers as of July 30, officially unemployed. Cyclic capitalistic economic crashes has been a regular part of the world's economy for hundreds of years, but the onset of the current one has been much quicker and vastly more devastating than the normal. The US now has the world's highest number of COVID-19 fatalities, over 150,000 as of July 25. China, with 4 times the population, has had fewer than 5,000 casualties. This stands as a monumental indictment of the capitalist system, which is, of course, ignored in the capitalist media. The chaotic disorganization in the United States and its inability to consistently test and report the results of this testing, even 6 months after the virus started to spread, exposes the fragmented, profit-driven infrastructure of healthcare in the United States. As several article highlights, China, by contrast, although hit first by the virus, has exhibited an orderly, scientifically, and highly organized response on a national scale. The response is still more impressive since China is a developing country coming from the oppressed, colonized, absolutely impoverished past. Even now, the development is highly uneven. With the outbreak of the COVID-19 virus, after a short period of planning and evaluation, the whole country shut down, practicing social distancing, strict health protocol. At the same time, those responsible rushed tons of equipment and thousands of medical personnel outfitted head to toe in protective medical gear to Wuhan, where 2 fully equipped hospitals was constructed within weeks in Wuhan to care for the surge of the COVID-19 cases. They instituted food distribution, orderly shopping, a guaranteed income, and a freeze on all rent and current credit card payment. Free national health care already existed. Massive national testing immediately confined to the spread of the virus. In other places where building socialism is the goal, even its countries starved for resources, including Vietnam, Cuba, Venezuela, North Korea, to the state of Kerala in India, a mobilized population has proven that the best protection against the virus and has kept casualties low. After it brought the pandemic under control, China sent hundreds of plane loads of medical equipment to every country in Africa and throughout Asia and shipped essential supplies to Europe and the United States. The US government went into the opposite direction. As the very moment when it appeals for human solidarity and cooperation was most needed, Washington was instead hijacking and redirecting supplies from countries it had put under sanctions. Almost finished. Competition for all costs. The US failure to adequately test the population represent a failure of a system. US has no national care system. A majority of the authors in the books focus on this failure. Medical insurance is generally tied to employment and care is provided on for a basis by giant hospital groups, pharmaceutical monopolies, labs, and urgent care centers. The few states and city agencies that provide low cost or free health care to the poor were already gutted of funds. In the past decade, many social services have been privatized and contracted out to private corporations. Ending up, as a result, as of July 30, the US still has one of the lowest rates of testing of any impact country. This has hampered the ability to get accurate information to spread the map of COVID-19. Because the US lacks a national healthcare system, the reporting of local test results to state and national database is still in complete disarray. The same thing is true of the treatment plan and allocation of scarce medical supplies. In the spring, the world epidemic of the virus began in New York, a financial and media center and the largest city of the US imperialism. This made the medical chaos impossible to ignore. Now it's spreading across the country and is far from control. University labs that try to fill the gap and help produce test kits run into a wall. Hospital system and health insurance conglomerates are locked into exclusive contracts with giant private labs, the LabCorp and Quest, which was competing and then incompatible with software programs. It is also impossible to enter a test results that is out of the network, according to the New York Times, May 21st. The racist and arrogant Trump administration is not the only cause of the COVID-19 fiasco. State governors, city mayors, Democrat and Republican are also trapped in the tangle of conflicting regulations, competing lobbyists, exclusive contracts, and unconnected platforms. Even arriving at a consistent and timely count of the number of positive cases and soaring fatalities is still impossible. Last paragraph and ending. In late March, a Congress hammered out a bipartisan $2.1 trillion stimulus package, making great promise of relief for workers and small businesses. But most monies allocated to small businesses had to go through the banks, which required the relationships that many Black and Latin-owned businesses didn't have. Extra federal benefits to unemployed workers went through overwhelmed. Let me reread that. Extra federal benefits to unemployed workers went through overwhelmed and unresponsive state unemployment offices. Some workers waited months before receiving any money. Migrants, prisoners, and homeless people got nothing. I'm concluded. This is from the recently released book, Capitalism on a Ventilator, The Impact of COVID-19 on China and the US, an anthology of a social justice activist discussing a global choice, cooperation or competition, edited by Sarah Flounders and Lee Soo-hin, project of the International Action Center and China-US Solidarity Network. What I'd just like to end is a note. The Governor Cuomo of the state of New York went to a number of the African communities in New York City, and he mentioned Tuskegee experiment. But at that time, in times before and after that, he indicated in public record that he, the governor, is not going to take the vaccination. That the vaccination should be taken by Blacks, Hispanics, and the poor. I want to also make a mention of Dr. Fauci. I was recently asked about my definition of a herd immunity, and I explained that I really didn't understand that concept of herd immunity. So I refer you to Dr. Fauci's statement of CDC on public record. He indicated that 90% vaccination should give herd, 90% of a population should be vaccinated to get herd immunity. Subsequent to that, he indicated that, oh no, it should be 70% vaccinated for herd immunity. And then further asked, he says, well, it's really an estimate, we don't know. I'm finished.
Thank you, Dr. Lewis. Let's see, did I mute myself? Yeah, no, I'm not. Okay, listen, we still have some time and we don't have to end exactly on 6. I know people have been here for a long time, but I know you have questions. Please paste your questions in the chat and I will read them out. If you paste them before, you need to paste them now because I'm only looking at the bottom of the chat. I must remind you also, please donate to CEMOTAP. I've left 3 ways that can be done. And I thank you for your generosity to the Peace Health Center last week. Sister Shadidi has thanked you. And I don't see a free online course. And these are some courses. There are other things people are putting on. But would you please, if you have a question for Dr. Lewis, a question for Dr. McCurtis, a question for Dr. Jones, a question for Dr. Randall, or Dr. Kinsey, or any of the people that have spoken today, please speak now. I know that I have in our group, have Brother Onaje.
The sensitivity shows is a decency that.
When I say ask your question, I mean to write it in the chat. Brother Onaje, I know from Cobra is here. I don't know if Cinque, Brath, or Brother the other Brath, Braithwaite, both of them are Braithwaites. They are involved in science, and one is involved and knows a lot about the Genome Project. If you're here, give me a note in this chat so that I can acknowledge you and also have you perhaps say something. Basically, people were telling you, thank you, Dr. Lewis. That's it. Well, you dropped the mic on them. They all just saying thank you. Nobody's asking you questions. He asked, how accurate are the PCR tests? That's Timothy Hunter asked for you, Dr. Lewis.
I can't answer the question. There's many reports that say that this test was instituted and prevented and it was not to be used the way it is being tested. Now you can, if that's in the record, you can look at that. The PCR test, the main test that they are given, it initially is stated that wasn't to be used in the manner that it's being used. And the other comment I make is that mention to what the head of the CFO of the Tesla company I forgot his name, made a statement about a month ago. He said he went to an institution and got tested 4 times. Same institution, same nurse, same facility. 2 of the tests came back negative, 2 of the tests came back positive. His name is Elon Musk, M-U-S-K.
Okay, if our speakers have any closing words, feel free right now to unmute yourself and say the people who are scheduled. I'm speaking of Dr. Randall, Dr. Curtis, Dr. Kinsey, Dr. Jones. All right, if not everyone, I want to say thank you to all of our speakers. I hope this has been a valuable presentation for you. I want to remind you that on the 3rd, I will be beginning a program called The Mind Field at 2 p.m. on Wednesdays on WBAI. That's The Mind Field. 2 p.m. on Wednesdays on WBAI. My first guest is Dr. Barbara Justice.